Welcome everyone back. Hope everyone had a good lunch. We are going to go to agenda item 23, Health and Human Services fee. We'll turn it over to staff for presentation.
Thank you. Good afternoon, Chair Fletcher, members of the board. We're here today to request your approval of proposed fee updates for the Health and Human Service Agency for fiscal year 22-23. The agency remains committed to maintaining the highest quality work product and customer service while maintaining and whenever possible, reducing costs. I'll now turn it over to Amy Thompson, our Finance Director for the agency, to walk through the proposed fee updates. Amy?
Thank you, Nick. Board Policy B29 requires full cost recovery for services provided to agencies or individuals. To ensure compliance with this policy, our departments have performed a comprehensive analysis of services provided to examine the tasks and functions performed and their direct and indirect costs. The board last approved revisions to HHSA's fees on April 6, 2021. In preparing the update for fiscal year 22-23, 83 fees were analyzed with 39 updates proposed. 44 fees required no change as the majority are tied to Section 239 of County Administrative Code 15B, which sets the fee as the lesser of the published Medi-Cal rate or calculated county cost. The proposed ordinance represents a comprehensive package that seeks to support the cost of providing HHSA services while maintaining fees that are fair and equitable for customers and the public. The majority of our updates are in public health services for the laboratory, with one update in behavioral health services and one new fee in public health services under the Tobacco Control and Resource Program. The 39 fees impacted reflect updates for increases in cost of doing business, decreases to reflect efficiencies, or deletions or additions to reflect stakeholder needs or current use. Fees are not a significant driver of revenue for HHSA's $2.8 billion budget, and the fiscal impact of these updates is estimated at just under $300,000 for next year. On the next few slides, I will review the updates proposed, grouped by program area. The 37 public health lab fees are either tied to environmental testing, such as testing of drinking water or foodborne illness investigations, or clinical testing, such as tests for communicable disease outbreaks, sexually transmitted diseases, and rabies. For the lab, most of our stakeholders are other county departments. Therefore, these fees are not a significant revenue generator for the county. We do, however, keep these fees updated for those circumstances in which costs are recoverable through federal or state funding sources or through other jurisdictions. Increases primarily reflect updated salary and benefit information and higher materials costs in some areas, but there are decreases as well, reflecting lowered overall costs for certain tests. You will see on the slide that 6 new fees are proposed for tests currently being performed by the lab, and 6 fees are being deleted for tests that are no longer necessary or are now being performed by the state laboratory or Centers for Disease Control. In our Behavioral Health Services Department, there is a private pay fee for the county-owned and operated Edgemoor Distinct Parts Skilled Nursing Facility, in which an increase is proposed to align with updated full cost recovery information. At Edgemoor, patients are typically covered under Medi-Cal, but there is a rate established for private pay scenarios. Out of the 192 beds at Edgemoor, there is currently only 1 bed being reimbursed under the private pay structure. Lastly, clarifying language was added in Section 240 of the Administrative Code to identify substance use disorder cases in addition to mental health cases as a service where ability to pay is to be determined. And the last area I'll review is one new fee for the tobacco retail licensing program in public health services. On December 8th, 2020, the County Board of Supervisors approved a new tobacco retail licensing ordinance for the entire unincorporated region of the county. The ordinance requires retailers to obtain a license to sell tobacco products and to comply with certain operating and tobacco product requirements. The ordinance went into effect on July 1st, 2021. Effective July 2022, an annual TRL fee is proposed to be required to obtain a license. The full cost recovery TRL fee calculated for fiscal year 22-23 is $1,460 per tobacco retailer. HHSA is proposing a 3-year phase-in approach for the fee beginning in fiscal year 2022-23 to mitigate the impact of the new fee to the retailers by staggering full cost recovery within a 3-year period. For fiscal year 22-23, the proposed fee is $730, or 50% of the full cost recovery. 5 stakeholder meetings were held over the period of April 22nd through May 19th, 2022, to specifically discuss the proposed fee. Invitations to provide feedback were extended to retailers, business associations, and public health and social service organizations. Following board approval of the TRL fee, retailers would be further engaged via email updates, quarterly webinars, listening sessions, and outreach through various channels. In summary, the requested actions before you today are to approve the introduction of the ordinance amending sections of the San Diego County Administrative Code related to HHSA fees. If the board takes action as recommended, then on June 14th, 2022, the proposed ordinance will be brought back to the board for consideration and adoption. This concludes my presentation. We are available to answer any questions you may have. Thank you.
Thank you. Let's hear from our public speakers.
Thank you, Chair Fletcher. We have 33 total requests to speak, 11 in person, 22 by phone. I'd also note for the record, we have 59 e-comments, 24 in favor, 31 in opposition, and 1 neutral. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions provided to you. We'll begin with the in-person speakers, and I will call them forward in groups of 5. I'd like to invite forward Audra, Marlon Mansour, Fred Moku, Jeff Mansour, and Mark Dorian. All 11 of the in-person speakers are in opposition. Welcome to come forward in any order. You have 2 minutes to address the board. Please begin by stating your name for the audio record.
Good afternoon, Chair Fletcher, Vice Chair Vargas, and County Board. My name is Marlon Mansour. I am the president of the Neighborhood Market Association. In just 10 months, the tobacco ordinance has devastated local retailers. The effects of which have trickled down to their employees and customers. Now, to add insult to injury, these retailers face the prospect of the largest tobacco fee in the entire state. I have shared with all members of the county board yesterday the NMA's position in opposition, a letter that also includes a comprehensive list of neighboring localities throughout the entire state and their tobacco license fees. Those of which include that the proposed fee of $1,460 in this first year being 3 times the amount in San Francisco and Los Angeles, 4 times Oceanside, and 7 times the city of San Diego. All to monitor and enforce 330 licensees. If it will cost $1,460 to cover just 330 licensees, there must be a problem with the way that the administration is being crafted. Don't hurt our businesses anymore. We have a few asks. One, delay any TRL fee until January 2023. As has been discussed, the city of San Diego has just implemented a fee. The state referendum will be set in January. We also asked to change the phase-in to 5 years to spread the cost, to spread out the cost. Thank you so much for your time.
Hello, Supervisors. Thank you for your time. My name is Jeff Mansour. I am here to represent small businesses. When the county banned flavored tobacco like menthol cigarettes, Copenhagen, Grizzly, Backwoods cigars, and electronic cigarettes, this had a big effect in the stores. It is hard to stay in business when your competitors down the street or in neighboring cities or the internet can sell it while you see your customers just disappear. Some stores report down 30, 40, up to 50%, especially in areas like Spring Valley. The reason why they are down is because customers want a one-stop shop. This forces all their other categories they sell to go down. These stores cannot handle any more pressure or loss. Although I understand the intent, it simply doesn't work and it's not fair. I want to ask the supervisors today to please wait for the fees until January, because the referendum for the state ban is around the corner. If the referendum fails, then we know the state will use its own enforcement and will increase the state license to the stores, so why double charge? The polls show that 65% the referendum will fail. I also want the county to do an annual report to see the effectiveness of this ordinance. And last, to please spread the fee or amortizations to 5 or 10 years so that the struggling stores can afford it. Please do not turn your backs on small minority-owned businesses. Many of these businesses owners are Middle Eastern Americans, they are Asian Americans, they are Latino Americans, they are African Americans, and from many other descents. Please show some compassion to small businesses and your constituents. Please don't listen to lobbyists that portray small businesses as big tobacco. Thank you, sir.
Audra, more fees, even though we pay HHS to do all the things that they're doing. It's great, didn't she say $2.8 billion? That's a lot of money that you but yeah, let's feed the people so that, I mean, especially for things that we're not asking you to do, like, testing the environment so that you can perpetuate your climate change shenanigans. Drinking water. I mean, are you really testing it? Because there's a whole bunch of toxins in it. You actually can't drink it without it being filtered. It's totally disgusting. We're not doing anything about that. Foodborne illness and communicable disease outbreaks. I mean, we already know that COVID is a sham. So, I mean, any of the testing that they're doing, it's like we're paying for them to test our wastewater, test our poo, so that in the future you can see if there's an outbreak. It's laughable what you guys are asking us to pay for, because we don't want any of that. But yeah, we have to continue to pay fees for them to do things that, allow you to get more money and funds to, continue, stealing from the people and racketeering, how about? And then the whole tobacco thing, like, yeah, let's make it harder on small businesses to make money, all while we're trying to save the businesses and make sure that, they're able to make a living and whatnot. I mean, how about, like, if you really cared about tobacco, why don't you get rid of it instead of being like, let's just charge people for it? Because then we can get money for it. I mean, everything you guys do, you just want more and more and more money. When is it enough? Like, it never ends. You just want to locate more funding, get as much funding as you can, make the people pay for these services just in general with their taxes, and then fee them more. It's great.
As the next speaker is approaching, I'd like to invite forward the remaining in-person speakers, Louis Zetuna, Chris Mattia, Anthony Isa, Yusuf Jibrail, Jason Robo, and Ramon Mansour. Sir, please begin.
Mark, Audrey was asking when it ends. Well, it ends when everybody doesn't own anything, and you have universal income for all. And we're bankrupt, and they say the American system didn't work and capitalism didn't work, which is bullshit because it's really crony capitalism that isn't working. And more fees, more charges. It'll never stop until we're completely broke, which Klaus Schwab said when he stated for the World Economic Forum, in 2030, you'll own nothing and be happy, which is a lie, of course. And Klaus Schwab is a rich German businessman, and he owns a lot, and he'll own a lot more by 2030, while you maybe do own nothing. Such a scam. It's so absurd that Nathan Fletcher and Newsom are both members of the World Economic Forum, which is diametrically opposed to our sovereignty as a nation and wants global governance, and that our Republican district attorney does nothing about any of this when there's a direct conflict of interest. And I mean, it couldn't be any more direct. And I'm not for jailing you, Nathan, or hanging you or anything else, but you shouldn't be in government. And that's very kind. So anyway, yeah, the usual scam, raising more fees and charges over things that you're causing with your system in the first place, problems that you're causing with your system. 23 seconds left. And I'd like to add what an absolute insult to intelligence it is that we get 2 minutes to discuss 20 items. These people think that everyone in society here in San Diego is retarded, and because most people have to work and can't pay attention, that they're just doing this like because you'll put up with it. It's absurd.
There's no outbursts in the chamber. It's your first warning. Next speaker, please.
Good afternoon. First, I want to say that some of the gentlemen you called on had to leave. My name is Ramon Mansour. I'm a small business owner. Been here pretty much my whole life and went to San Diego State and now own business in the unincorporated county. And first, I'd like to make a statement that there would be more of small business owners here represented. But remember, you're dealing with small business owners. That means they're family business run operations. They're small businesses, and it's very difficult for them to leave work, leave their community that they're serving to take time off, especially situations like this where pretty much you need the entire day to be here, as well as making it very difficult to call in. I mean, I went to San Diego State. It's pretty cumbersome what you put the people through to just make phone calls to give their opinions. But I'm here to ask, please, take it easy on these small business owners. To you, maybe $1,400 is not a lot. To them, it's a lot. These are family-run operations. It's already been very difficult for them, and take it easy on them. You guys already took practically half their business away with the flavor ban. We get the intentions. I'd love to ask you to amortize it over a longer period, at least 5 or 10 years. Let their businesses get adjusted, as well as please review this annually to see if your TRL and what you're doing is working and if the fees make sense, if you guys are actually using the funds properly, and you guys put this ban put a $10 minimum sell item. It's a lot for these guys. Please. Thank you.
Jason Robo. These are my spliffs notes. I vaporize, but I do smoke a spliff every now and then. Yeah, you guys like civic engagement, but you don't allow free speech. You inhibit it. Yeah, I wonder, you're taxing, people take shots or people that want to smoke, but why are they not taxing the vaccines? I don't know. That would be great, I think. Yeah, you're just trying to control our holes and like what people do. But I have to say, you know, I'm not necessarily like into like smoking. I've said before, I'm a personal trainer, or nutrition, other backgrounds. So, I mean, I do think of some of his pulmonary parasitism. But yeah, flavored tobacco versus whatever. I mean, I think some of it eats ass in general. But yeah, speaking of butts, that's a pollution problem. They should be like made out of something that's biodegradable. And nobody's paying attention, which is classic for government. They really care about public engagement. You'll hold meetings about transparency. That's actions speak louder than turds, I guess. I don't know. Yeah. Let's see, we got pollution from the cigarette butts. I think that's a problem. There's just a lot of problems, and you don't really seem to care about it. Tobacco cessation is a thing. So if people want to smoke flavored tobacco through a vaporizer, oh, I got a quarter of a glance from Fletcher. Maybe he thought I said something about house fires. I don't know. I'm talking about smoking, but anyways. Don't laugh, you're gonna get kicked out. I'm running out of time here. I smoke a mean-ass hookah, and I got mad props from people in the Middle Eastern community for being a fucking legit white boy who could, I don't believe in race, but whatever. There is sugarcane shisha, and anyways, this is just all a bunch of rigged BS, and you guys are riggers, goddamn riggers.
Thank you.
Hi, Chris. Basically, the government here are parasites. You don't produce anything. And you're parasitical.
Excuse me, ma'am. I'm going to pause I'm going to pause your time. Could you please state your name for the record?
Chris.
Did you put in a speaker?
Yeah, I did. Chrissy.
Gotcha. Thank you.
Yeah. Okay, so being that you're parasites, you don't produce anything. You just suck off of other people's production. And I guess that's funny to Nora. But because what you're doing is you take from other people's hard work and you destroy it. You're raising costs on gas and on inflation is skyrocketing. Maybe you're doing this with to the small businesses, and they're here begging. I hear them begging to have some compassion on them. But of course you don't, because you're sitting there going to impose harsh restrictions so that the American citizen that has worked hard is going to be crushed by your policies, and you could care less how much they are harmed. And the little bit that is, maybe there's a little bit of revenue that you get, but it's better, you make more by crushing the businesses. And I don't know who's going to benefit, because like they said, they just go to another county or they import it in, and you don't have a way to really control people's behavior, but you will wreck people's businesses. Good job.
Now we'll hear from those that requested to speak by phone. When it's your turn to speak, you'll be unmuted. You'll hear a recording that will tell you to begin your comments after the beep. I'd remind callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller.
Hello, this is Kemi Pavlicek. Am I on?
Yes, we hear you. Go ahead.
Okay, hello, yes. I am the owner of Montezuma Valley Market. It's located in Ranchita. Our store burnt down last year, but thanks to the assistance of Supervisor Desmond's staff and a few of the building and food department, we have a temp building currently up now. Concerning this tobacco licensing fee, if this does go into effect, we would have to we won't be able to carry any tobacco for our locals. They are the only reason why we have them. And for funds, as an example of how this is used, we had 2 of the tobacco control employees come to our 600 square feet temporary store to look at 6 cartons of cigarettes and tell us that we should put pricing on it. So that basically sums up what they would do, and is not worth it. I get it. Tobacco is not healthy. It's not good for anybody, but we have it there for our locals so that they don't have to drive 15 miles to the next store, because we are it in our town. And this does have an impact because we already pay for a fee on the state level. On a side note, particularly for rural businesses like ours, I get it, like Supervisor Fletcher mentioned, for fees. You are responsible for paying it, but I think we need to relook on how the fees are charged. Instead of it being a flat fee across, small businesses in rural communities shouldn't be paying the same price, especially as other businesses in the cities, or even some of your Dollar Trees, your 7-Elevens, because we just can't compete anymore.
Thank you. We'll now hear from the next caller.
Hi, my name is Mike Namu, calling with Crafter Selections, and I oppose. Can someone hear me?
Yes, we hear you. Go ahead.
Good. I gotta, feel the, amount of pressure you guys are going through. But, as a businessman, seeing the fees kind of rise, within a year, that's an inflation of anything else. Us businesses, we do, work on thin margins on tobacco. And I feel like, you guys are sending a message where we shouldn't be selling tobacco at all, the way this, this direction is gearing. I believe that the fact that, passing on such fees onto the consumers themselves will, also, be an inflation. We do our best to, of course, to comply with the rules and the laws. I really believe that the county should give some kind of consideration or reconsideration on the amount of fees for renewing tobacco licenses. I would, like to see if we can, look at partnering with the education, with the local branch government. That's where we need to start focusing, not focusing on raising fees and try to drive business out of San Diego. I oppose this bill, and I hope that you guys will look at looking at other areas to partnering us retailers to make a nice working relationship for all retailers in the future.
Thank you. We'll now hear from the next caller.
Chris Mattia. Hello, my name is Chris Mattia. I have a store in Rancho San Diego. Since the tobacco ban, my business has been heavily affected. As of today, I am down 35%. I laid off 2 of my employees, and I've been working much harder. I was actually there today, and I had to leave because I can't afford to pay my employees anymore. Please wait until January to be together with the city ban. Give us some time to recover. I would also like to ask for for an annual report. Please also extend the fees for 5 years. Thank you.
Thank you. Now hear from the next caller.
Good afternoon. My name is Barbara Gordon. I applaud the Board of Supervisors for adopting a strong TRL ordinance. As a youth advisor for a Hispanic youth group, I am concerned with the increased use of tobacco by our youth and young adults. An effective use of a TRL is to reduce inequities in how tobacco products are marketed and sold in underserved communities. The fee is necessary to ensure the program is successful, sustainable, and effective at reducing illegal tobacco sales to youth. The county must identify all the government activities required for oversight, including annual compliance checks with escalating penalties for violations. The licensing fee is a key component that needs to cover the total cost of the program. I respectfully request you do not delay the implementation or reduce the tobacco licensing fee for the first 2 years. As a taxpayer, our tax dollars should not be subsidizing the tobacco retailers. A strong TRL will reduce the access of tobacco products to our young people and will make our stores a healthier place to shop for everyone. Thank you.
Thank you. Now we'll hear from our next caller.
Hi, my name is Chelsea Walzak-Burks. I'm the Community Impact Director for the American Heart Association and the co-chair of the Tobacco Free Coalition of San Diego. We appreciate the county and the staff for their work to create a model tobacco retail license, a TRL program, and set an annual fee for retailers that fully covers the cost of the program. Local tobacco retail license programs are considered the best means of protecting kids from nicotine addiction because they reduce illegal tobacco sales to youth. Today, youth under the age of 21 are often able to purchase tobacco products at all types of stores, ranging from convenience stores and gas stations to large chain grocery stores and vape shops, even though it's illegal to sell tobacco products to minors. This is in part because of the statewide tobacco license program has infrequent checks on stores and weak penalties for violations. Findings from the county's own compliance check operations in 2020 show that 20% of tobacco retailers in the unincorporated area illegally sold tobacco products to youth. 20%. That is an alarmingly high rate and underscores the urgent need for the county's program. San Diego County's TRL program was created to address this problem and has since become the model for communities all around the state because of its comprehensive enforcement structure. In fact, nearby communities now look to our county as an example for their own programs. The annual licensing fee proposed today is the only way San Diego County can sustainably and reliably ensure stores are not selling tobacco to kids. We urge you to support this measure. Thank you for your consideration.
Thank you. Now hear from the next caller.
Hi, this is Peggy Walker. As part of a coalition working to keep tobacco out of the hands of youth, I thank you for including youth decoy operations as a fee cost category in this proposal. Youth decoy operations are more important than ever as kids continue to turn to tobacco for anxiety and stress relief. While Big Tobacco makes billions marketing e-cigs as tools for stress reduction, that strategy hasn't worked for young people. It's a vicious cycle. Teens vape to get a short buzz, then again to recreate the feeling, and again to the point of addiction. Minority communities are often hardest hit with teen use rates. In the National Tobacco Survey last year, Latino middle school students reported highest ever rates of e-cig use. It's not surprising Latino communities also have a higher density of tobacco retailers. Youth decoy operations are important everywhere, but a focus here would be worthwhile. Thank you, and I support this.
Thank you. Now hear from the next caller.
John Mansour. Hi, can you hear me?
Yes, go ahead.
Yes, my name is John Mansour, and I've been affected by the recent ban. I'd like to explain what we've experienced in the last 10 months. We've had to explain to our customers that we've been serving for over 20 years. We no longer carry what they've been buying from us, but yet they can still buy it down the street. We've had to explain to our customers why we lost our favorite employees because we can no longer afford them. And now you're trying to pass a new fee that's not affordable and get more expensive than the rest of the state. It just doesn't make sense. What you have done is take our knees, our feet from under us. You're making it very, very hard for us, and it doesn't make sense. It doesn't make sense of what you're trying to do and who you're trying to do it to. You've already crippled us, and we're struggling to survive, and yet causing or adding more fees.
We're being targeted, and it just doesn't make sense. We're hurt. We're struggling. We need help, not more fees. And that's all I can say, is we need your help. You're here to help us, and we need it. So please help us and not tack on more fees that we can't afford. Thank you.
Thank you. We'll now hear from our next caller.
Yes, we can hear you. Go ahead.
From the next caller, Cynthia Knapp, your device might be muted.
There we go. Thank you. I just had to pull over real quick. Okay, good afternoon, Board of Supervisors. My name is Cynthia Knapp. I'm with San Diego. I'm a District 2 resident and a mother of 3. I work in District 4. I would like to first celebrate our friend and colleague, John Byron and NCPC, for their honor this morning. We're so pleased for you. Thank you, Board of Supervisors, for your leadership in protecting your constituents, particularly the youth and our priority populations from nicotine addiction. Enforcing our tobacco sales laws is essential. The comprehensive TRL will ensure our retailers are not selling to people under age 21 and enforce the ordinance that ends the sale of flavored tobacco, a crucially important policy. Delaying enforcement is a disservice to the retailers and the community. Annual compliance checks support retailers in knowing and understanding the county's tobacco sales laws. The data shows that jurisdictions with comprehensive TRLs see youth sales rates drop to single digits. Some in California are as low as 5%. As you heard, the most recent county data shows illegal sales rates in the unincorporated areas are about 20%. Our neighborhoods can do so much better with a strong TRL program such as this in place. Lastly, the fee associated with tobacco sales law enforcement should be covered by those benefiting from tobacco product sales, not by the lay taxpayer. Thank you again for your commitment to the youth and to our community.
Thank you. We'll now hear from the next caller.
Good afternoon, Chair Fletcher and members of the Board of Supervisors. My name is Linda Barber. I'm with the American Cancer Society, and I'm here in support of this TRL fee. I urge you to assure that the costs of your tobacco retail license program are fully funded by fees that cover the cost of administering the program. Commercial tobacco control laws, including regulations on the sale and distribution of those products, are first and foremost a public health measure, and we are proud of the County of San Diego's strong tobacco retail policies. They are amongst the strongest in the state. A tobacco retail license facilitates effective, equitable enforcement of commercial tobacco control laws by holding businesses and other industry actors accountable for those violations. And in 2020, the American Cancer Society Cancer Action Network supported the county's plans for the initial adoption of the tobacco retail license, where the costs were subsidized by a state grant to fund enforcement, and a board-authorized budget allocation helped launch the program, allowing county staff to develop a budget based on the actual costs incurred to run the program. During those hearings, retailers emphasized that they supported a licensing program because they were following the rules when it came to not selling illegally to youth. However, this recent illegal sales rate have been recently found under the initial monitoring tell a different story. Too many merchants are still selling to youth illegally, and now it's time for them to be held fully accountable by not only paying fines and penalties, but by paying for the cost to administer an effective program that will hold them accountable. The 3-year phase-in seems to be a reasonable compromise, but costs should ultimately be borne by those who profit from tobacco sales and not by taxpayers or those who don't use tobacco. The board should vote to pass on the actual cost of the program to retailers who wish to sell tobacco products, and support the budget request today to assure that the program is sufficiently funded. This will assure a stable source of funding for this important work. This is our youth need your protection. Thank you.
We'll now hear from the next caller.
Good afternoon. My name is Becky Ratt. I'm a parent to 3 teens. And the vaping of tobacco and nicotine products by youth has become an epidemic. It's crucial that local tobacco stores be held to the highest standards in protecting our young people. I'm pleased with the amendment that staff has brought forward, providing fees for tobacco retail licensees. It's crucial the county foster health equity and reduce access to nicotine and tobacco products by enforcing a minimum legal sale of age, or MLSA. The most effective way to analyze MLSA is being observed through the process of conducting minor decoy operations. Tobacco retailer licensees' fees are the most effective way of ensuring cost recovery. As a parent of 3 teens, I couldn't help noticing that the staff report indicates a goal set to achieve 80% compliance. While a compliance rate of 80% is achievable, I would like to see that compliance goal even higher. Can we not strive for 100% compliance? Thank you.
Thank you. We'll now hear from the next caller.
Fred McCoo. I'm opposed. Hello, my name is Fred McCoo, and can you hear me?
Yes, we can hear you. Go ahead.
Okay, my name is Fred McCoo. I'm a small business owner in San Diego, and one thing that I want you to remember already to understand that we already have so many licenses and permits to run our business. One of the license that we have already is tobacco license. We have it through the state of California, and we pay $265 a year for it. And we have a tobacco license already. And now it has to have another tobacco license through the county of San Diego. These fees will affect the business owners, will affect the consumers. And this is already, as you know, it's very hard for business owners to comply with all regulation, with all of that. And there is a lot of the people that we spoke before me, and they've been mentioning, they blaming the business owners. There is probably one bad apples, but most of our businesses we run, we don't have no violation. We don't sell to the minors. One thing that you have to understand, we don't sell to the minors. We are very strict. We have the system, the scanning system that doesn't allow to sell to the minors. And I don't understand why they have these figures that we are the small business sell to the minors. There is somehow the minors, if they need to get the tobacco or anything else, they can get it somehow, but not through our businesses. One thing that you have to understand, please do not vote for this, and do not, they have their opinion, I respect that. I don't want my kids to smoke cigarettes, and nobody to smoke cigarettes. But fees, it's very hard for business owners. You can ask in Washington, the county needs a fee for any program to educate people. Ask Biden, that is given billions of dollars helping another country and not our country. You can ask Washington for the fees, not the small business owner punished.
Thank you.
For the hard work.
We'll now hear from the next caller.
Eleanor, I'm opposed to all of these taxes. It's very interesting that we have an epidemic of tobacco use, an epidemic of opioids, and everybody's so concerned about all these epidemics. Why don't you start taxing the heck out of food places that are causing heart problems, diabetes, and obesity? You don't seem to care about that. If you really cared about people's health, you would stop testing the water to see what more you could put in it that's toxic to us. You would start giving people healthy food, and you would stop finding a scapegoat like the people who sell tobacco. The caller who just called in is correct. He already pays taxes. Why do we need any more taxes for something that you decide to make the scapegoat so that we are distracted from everything else that you are doing, which is making everybody sick? Why don't you tax the COVID injections that are killing people? I suppose we should kill people for free. Is that what you want us to do? We really aren't talking to you, the Board of Supervisors, because we know that you've already made your decisions before you even come to the meetings, and you don't care because you are following the global agenda. Let's put all small businesses out of business. Let's get the big corporations in so that, as previous callers have said, we'll all own nothing and be happy about it. I wonder what you're going to own and what your children will be happy about.
Thank you. We'll now hear from the next caller.
Truth. Mr. Jeff Mansour, that was a good point about the double charging. This item proposes a new tobacco retail license beginning fee of $730. The American Heart Association supports the fee because they say it will, quote, ensure retailers are not selling tobacco to youth and that youth are often able to purchase tobacco products at all types of retailers, end quote. Both of those statements are completely untrue. Expensive fees only ensure that the prices at tobacco retailers will be higher for both operators and customers alike. Can you imagine if the American Heart Association actually cared about people's hearts and suggested high operating fees for, say, McDonald's instead? Of course, that won't happen because in 2018, the AHA actually applauded McDonald's so-called healthier kids meals. That's how much they care about our hearts. And on their website, what is the American Heart Association actually interested in? Reimagining research, transforming communities, and World Economic Forum leadership roles. Surprise, surprise. And for the AHA to say that youth can often purchase tobacco at retailers is a ridiculous lie. Retailers require ID to purchase tobacco, just the same as for alcohol. I would much prefer to see this type of concern aimed at marijuana retailers who instead seem to be getting many loopholes and handouts for their businesses. This expensive new fee for tobacco retailers is just another money grab, which according to this plan will increase every year. Something else interesting in this item is the elimination of clinical fees for the SARS-CoV-2 architect fee, the HIV antigen antibody test fee, and the HIV-1 viral load test fee. Why is that? Anybody know?
We'll now hear from the next caller.
Hello, this is Kelly McCormick. I'm a parent and public health educator. I support the tobacco retail licensing program funded through fees paid by tobacco retailers. This will give the county a framework for ensuring that retailers are complying with the law. The fees will cover the cost of processing applications and issuing licenses. And importantly, they can provide funding for retailer education, compliance checks and inspections, decoy operations, and other enforcement actions. As you already recognize, flavors hook kids. The Truth Initiative conducted a nationwide study of teens who had used flavored vape products in the past 30 days, and 74% said they had purchased them in a physical retail location. More than half had obtained vapes through a social source, and only 6% had purchased vapes on the internet. The nicotine levels in vape products are far higher than in traditional cigarettes, making them much more addictive. These fees are reasonable. Minor decoy operations are essential. These steps will present no problem for retailers who are abiding by the law. Thank you.
Thank you. Now hear from our next caller.
My name is Carol Green. I'm a resident of San Diego County, and I'm also the president of the California State PTA. In both of those roles, I support the tobacco retail license program to protect children by including the compliance checks on tobacco retailers. The fees for the program are reasonable and work, and this program has been shown to be effective throughout the county previously. San Diegans are proud of the TRL program adopted by the Board of Supervisors, which is the strongest in the county and one of the strongest in California. This valuable program deserves the funding to ensure that the program will truly protect children and the community from the tobacco industry. Retailers have said in the past that they support this program, and those that are not selling to minors have nothing to fear. Thank you for protecting our children. We appreciate it.
Thank you. We'll now hear from the next caller.
Good afternoon. My name is Terry Ann Skelly. As a parent of young adult sons, I'm speaking in support of the recommended TRL fee rate. It is a beginning in recognizing that there are real costs of tobacco smoking and vaping to young adults and families and the community. The costs are extremely high in physical and mental costs alone, which dozens of studies have confirmed. Tobacco retailer fees will be a significant step in interrupting the sales of tobacco products to under 21 population. This will go a long way to mitigate the human cost due to tobacco sales, promotion, and the normalization that is disproportionately affecting young people. Thank you.
Thank you. We'll now hear from our next caller.
Hello, my name is Luis Zaytuna. I own a business in the city of El Cajon, which I am still in the unincorporated area. When that tobacco ban happened, I literally lost 35 of my business. And no offense to anybody that said, oh, kids, stop getting it, kids, stop getting it. Kids started going to the next town and get it. But what happened with my business is it got crippled just by those customers that like to go do one-stop shop and go shop at one place. Stop coming over here so for the sake of them going 2 blocks away from me just to get all their products. On top of all that, now you want to implement a $1,500 fee on top of the tobacco fee that we already pay the state. What I'm asking from you is, can you just wait till January? Let's see what happens in November voting. So all stores can be in the same level, and nobody can have an advantage over the other person. I guarantee you, if you dig deep inside your heart and you look at this and you look at the big picture, you know what you're doing is wrong right now. You know this is not right. This is not right to play with people's livelihoods and people's income. I appreciate if you guys consider doing this and wait until January. Thank you.
Thank you. We'll now hear from the next caller.
Robert, there's been many comments on the TRL, but Truth raised a question about some of the other items that are related to public health laboratory testing. I'd like to draw attention to the public and to the board about some of these additions and increases. In particular, there's a net 10 increase of fees being applied. When we compare them to the deletions and decreases for certain assays being performed by, we heard in the presentation that some of them were being decreased because of being performed by the state. So it sounds like there's a potential duplication of some of these assays, particularly related to HIV, SARS-CoV-2, and Enterococcus. I do see that there are there's some different branding within the tests by certain providers, for example, PerkinElmer's. And so my suspicion is that these are tests that may be more sensitive to newer variants, and that the county is planning to use these to reinvigorate the reign of terror over COVID, because the original strains of COVID are not showing the test effectivity that they want to see anymore. So I would go about reducing Panther Fusion and bringing up instead Panther Aptima. Why don't we increase on the PerkinElmer's and 4-plex testing, Abbott 4-plex testing. Those 4-plex testing means that they're doing multiple assays in the same test, so that there's less discrimination between a positive and negative, whether it's due to SARS, influenza A and B, or RSV.
Thank you. Now hear from the next caller.
Good afternoon, Board of Supervisors. Ann Riddle here. I came this afternoon because I have quite a few teens in my circle of acquaintance through families and neighbors and groups that I work with as a parent advocate. I understand that teens may pick up smoking as a way to deal with stress and anxiety, only to realize later that it only has made their mental health worse. It seems that we could help our kids kick the nicotine habit or never start in place by ensuring that our tobacco retail licensees don't sell, and we can do this through a compliance check. I think it's good to remember about this discussion today that these are just fees that will cover the cost recovery for code enforcement, and that's so that taxpayers don't pick up the cost, but that tobacco retailers who profit from the sales do. Thank you.
Chair Fletcher, that concludes public comment on this item.
Thank you. We have this recurring problem where we privatize the profit for something and we socialize the cost. We take something and we privatize the profit generated off of it, and then we totally ignore the cost of what it costs a society for what that product produces. In the case of tobacco, it costs $300 billion a year is the public health costs associated with dealing with the impacts of tobacco. $300 billion is what it costs society as a whole to deal with the impacts of this product. And so to have people come and say that a $1,400 tobacco retail licensing fee, which is less than $4 a day, is somehow exorbitant when your product costs $300 billion a year to society is not the best argument. And I hear the argument that this fee is higher than other jurisdictions, which tells me that other jurisdictions' fee is too low. And maybe we need to start coordinated reaching out to those jurisdictions to tell them that perhaps it is not enough. Because who benefits from tobacco sales? I understand the businesses benefit from tobacco sales. Do the people who get cancer benefit from tobacco sales? Do the people who get respiratory disease and heart disease benefit from the sale of tobacco? I don't think that they do. And I like the idea of an annual report, but if we're going to do an annual report, it's going to include the cost of tobacco on San Diego County. And then we could have an honest conversation about full cost recovery. Because right now the conversation about full cost recovery is just what it costs to go out and administer the thing. If we want to really talk about full cost recovery and what this fee ought to be, then let's talk about what the cost of tobacco is in our society. And I look forward to that debate. So I appreciate so much of what we've heard today. It's inspiring me to give me some ideas for things that we need to work on in the future. But this is an action that is necessary. This county for decades and decades and decades has not had a tobacco retail licensing fee at all in any amount. And I think that with the action we're taking right now is entirely appropriate along with the other things in here. And I'll make a motion to approve the items that are outlined in this.
Second. Oh, sorry.
Second by Supervisor Wasserman. I'll now go to Supervisor Desmond.
Thank you, Chair, for your emphatic discussion here. But I do, want to be keeping tobacco from kids, and we need to do the compliance checks. We definitely have to do those. We implemented this in the city of San Marcos when I was there, and we would definitely want to keep the tobacco out of the hands of the kids. But I do have some concerns, about potentially the phasing in of this. I really think if we did a more phased in approach, right now it's 3 years. I mean, the retailers they're not saying hell no to anything. They're just saying, hey, can you give us 5 years on this thing? Because last year it was 0. In previous years it was 0, which, is our fault, potentially. And it's now to ask them to pay $730 and going up to $1,500 over 3 years, it's not gonna, if we haven't been paying anything here recently, or they haven't been, let's give them, I think, a little bit of a break. It's only a couple of years. And since COVID, many of these business owners, throughout the county, and these small businesses as well as the the Market Association, Neighborhood Market Association, they've been hurting. So to me, a couple of years is not going to break the bank. It's going to get the same job done. We're still going to do the compliance checks. It's just a couple year difference. So I think that's a reasonable ask from them. to have it go. And then to wait till January is not going to kill it either. So I think those couple of asks, they're being reasonable. They're not saying hell no. They're saying, well, we know this needs to be done. And just as kind of a side note, in San Marcos, when we put this into effect, is we actually made an incentive program to where, and I forget what the numbers were, but if after 5 years and you had, you're at least visited once a year, if you were at good behavior, your number came down. And if you were bad behavior, your number went up, and so it would compensate each other. But what we wanted to do is incentivize, and just if they have the same fee, regardless if they're doing good or not, but they have to still pay the fee is something that I felt we could do. But I'd like to ask if you'd be willing to take two friendly amendments to, or maybe one of them, at least go to 5 years instead of 3, and then start it in January 2023.
No, thank you.
Okay.
Supervisor Vargas.
So, if I think this is a fair process, and I went back and I asked our Health and Human Services folks about the 3-year phased approach. If it was up to me, we wouldn't be selling tobacco products. My father died of cancer in the lungs, and particularly in the African American and Latino communities, the tobacco industry has made a lot of money. And if it was up to me, we wouldn't be selling tobacco in our communities. So, it's America. People get to buy. They get to choose to buy tobacco if they want to. But I do think that we need to control it, and we should tax it because of the initiative that we passed a couple of years. We're able to fund the First 5 program, and we're able to make sure that we're able to put that funding back into the health of our communities. I actually worked on that initiative many years ago, which is why we're able to fund some of these programs. I am going to go ahead and vote for it and support it, but I do think that we need to make sure that we are, ensuring that we do have these types of fees. And this is nothing against businesses. We did create an Office of Economic Prosperity, and we'll find other ways to support our businesses, but tobacco is not the way to strengthen businesses in the county of San Diego. And we'll find other ways. I'm happy to meet with you to identify other opportunities for our small businesses, communities, to make sure that you thrive. But tobacco is not the way I'm going to help you. So thank you.
Thank you, Vice Chair. We have a motion by myself, second by Supervisor Lawson-Remer. Please vote.
Chair Fletcher, that motion passes with all supervisors who are present voting aye.
Before we go to our next agenda item, I'd like to, as a board and county, for us to take a moment of silence. There was a terrible tragedy in the state of Texas. 14 young children were killed by a gunman on a school. A teacher was killed as well. And I'd like to ask, as a county, we take a moment of silence for these children who went to school this morning, just being children and going to school, and are now dead. Thank you. We're going to hear items 24 and 25 concurrently. These are items brought forward by Vice Chair Vargas and Supervisor Lawson-Remer, and Vice Chair Vargas and myself. I'll go first to Vice Chair Vargas for any introductory comments you'd like to make.
Thank you, Chair Fletcher. Since we're going to be introducing both, I'll just mention that I want to say thank you to both yourself and Supervisor Lawson-Remer for the opportunity to work with you on both of these items. The first one, item number 24, is an opportunity for us to strengthen access to reproductive health care, conducting a comprehensive assessment of reproductive of our services in the County of San Diego and advocating for state legislation and funding for such services. You know, we have an opportunity as a county to really do an assessment about where we are and to make sure that not only women in our county but in our region have an opportunity to make sure that they have access to reproductive health care. It is hard for me to sit here in front of you in the year of 2022 to know that we are still doing this work. I have been in the reproductive rights movement for now almost 25 years, and when I first started doing this work, it was mostly trying to find a space, particularly for women and women of color, to make sure that we had access. And at the time, I remember fighting for to make sure that we had resources, to make sure that we had opportunities and access and so on. And here we are now in a space where women may not have access to legal abortion in the United States. And even though we were preparing for it for many years, I never really believed that it was going to happen in the United States. It was something that was happening in third world countries, and I never thought that it was going to happen here, and it might just happen. And so I think that we have a right and a responsibility to prepare not only in our country but in the state. And so I'm also very grateful that we are looking as a state, and I'm grateful to the governor and to the pro temp and the speaker for looking at legislation and really making sure that we are supporting amending the California State Constitution to enshrine the right to choose. And so I appreciate that Supervisor Lawson-Weimer is supporting that letter as well, to make sure that women in California never have to worry about that, God forbid, that anything would change here, and that there's actually going to be a legislative code so that the California Constitution protects a woman's right, a pregnant person's right to choose, so that we can make sure that California continue to move forward. And why this is important is because the difference that we have seen and the progress that we've seen for women in the last, 50 years because of access to reproductive health care has been phenomenal, right? Women would not be in elected office. Women would not be leading corporations. Women would not have the freedom that they have right now if it wasn't for reproductive freedom. And so it's so important, and we have to make sure that we continue to fight for that access. So I thank both of my colleagues for supporting both of these initiatives, and I think this is only the beginning of the work that we'll continue to do. So thank you for that.
Thank you. Supervisor Lawson-Weimer.
Thank you, Chair Fletcher, and thank you as well to my colleague, Vice Chair Vargas, not only for your partnership on this today, but I think for your lifelong leadership on this issue. And as you said, we've known for many years that this right was under attack, but to be at a moment where that fear is becoming a reality under our watch is something I again, with you, didn't completely believe would come to pass. I think the ability of San Diegans, of Californians, of Americans to live our lives in the way that we choose is under threat like few times in our nation's history. I think with the U.S. Supreme Court poised to overturn Roe versus Wade, our access to safe and legal abortion depends on what state you live in. And if you're even able to find the resources to pick up your life and cross state lines. I think just, it's been said before, and I think it's worth saying again, that the legal reasoning behind the Supreme Court's draft opinion could threaten marriage equality, LGBTQ rights, access to contraceptives, and more. And we cannot stand by while people across our nation are stripped of their rights and the progress so many have fought for is erased. So there are many things that we have to do and must do, but the first is the subject of this board letter. It's time for California to enshrine the right to choose in our state constitution. In light of the possibility that Roe v. Wade is overturned, we need to take action now to protect that right here in California. This constitutional amendment will build a firewall in California to ensure that we continue to have safe and legal abortion access, regardless of what happens at the federal level. This state constitutional change would also go beyond protecting the rights of Californians. If Roe v. Wade is tossed aside, over 24 states are likely to ban abortions or severely restrict access, with at least 13 states already having passed trigger laws that would ban abortions immediately or shortly after such a decision. Establishing the right to choose in our state constitution will make California a beacon of safe and legal abortion access for our fellow Americans who need it. The second thing we can do to protect the right to choose is to vote. 5 Supreme Court justices can interpret a law how they want, but millions of Americans send representatives to Congress to make laws that make abortion safe and legal in all 50 states. That's something else that we can fight for. So we need to take action today and call upon our state legislature and our governor to make the right to choose part of the Constitution of the state of California. But we also need to take action moving forward to support elected leaders who will continue to fight for these rights nationally as well as in our own communities. So again, thank you to my colleagues, and I can't believe that we stand at this moment, but I am really proud that we can do our part here in San Diego to make progress, at the very least, in the state of California. So with that, have you moved?
I'll make a motion.
Okay. I will second my colleague's motion. And was that for both 24 and 25? Or? Yes. Yep. Great. Thank you.
Thank you. There's no comments from the chambers. Thank you. I want to thank my colleagues, Vice Chair Vargas and Supervisor Wasserman. I'm honored to join you in one of these letters and appreciate this. The Supreme Court is poised to roll back rights that have been enshrined in this country for the entirety of my life. A day that so many thought would never be here is on the precipice. And I think it is important for us to recognize that even though under the draft opinion, if it becomes final, California will remain a state that can retain the right to ensure women's reproductive choice. That is only for now. You have seen many federal elected officials, members of Congress, say that their next step after this would be a federal ban on women's reproductive choice. And was mentioned by Supervisor Lawson-Remer, the underlying premise or argument of the draft opinion also lays a clear pathway to potentially take away the right to marriage equality, contraception, and a whole series of other things. And I think as a board, we are already on record under Vice Chair Vargas's leadership earlier of being a county fully committed to protect reproductive choice, but the actions we're taking before us today are to have our county assess what reproductive health care is out there, is accessible, is available, and identify any barriers for access to care that we could possibly as a board consider removing, and directing advocacy for regulatory, budgetary, and legislative efforts to strengthen access to reproductive rights and healthcare services at the state and federal level, and then also to go in full support of the actions our state leaders are taking. And I think the things we're doing are appropriate, are needed, and I'm honored to join in this effort. We have a motion and a second. Let's hear from our public speakers.
Thank you, Chair Fletcher. On item number 24, we had a total of 19 requests to speak, 7 in person and 12 by phone. On item number 25, there were 21 requests to speak, 7 in person and 14 by phone. I'd also like to note for the record that we received 424 e-comments on this item, 309 in favor, 104 in opposition. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions provided to you. We will begin with the in-person speakers. I will call you forward in groups of 5. I'd like to invite forward the following individuals: Alan C., Michael Brando, Audra, Mark Dorian, and Jason Robo. You can come forward in any order. You'll have 2 minutes to address the board. Please begin by stating your name for the audio record.
Hi, Alan C. Personally, I love what's happening because it puts a vote back to the state. So yeah, okay, yeah, let's bring it out. But my question is, with so many voters disenfranchised, what I talked to you about earlier, Michael Vu, as a 80-year-old man at that car show, will there be a fair election? That's my whole question on this. And yes, it's a very contentious issue, women's right to choose versus people like me that support, including my wife, that support life. Because the further you go towards the trimester, the more brutal it becomes. No matter how you put it, to dismember a child that you can feel kicking in the stomach, you can feel the heartbeat, and you know it. You've had a baby. You know that. You can feel that kick. Think about that child when they dismember it inside there. Cannot scream and utter a sound, and that's their first moment of life, is to be dismembered by this forceps. So, and as far as rape and incest, if your daughter ever got raped, I would want to rip the guy's face off. What I want to happen for rape and incest kids, castrate the guy and put him in jail with Bubba, because that's what should happen to anybody that does rape. And I feel horrible that any woman gets raped, but that's still a child. But why wait? Why do you have to wait till 6 weeks? Just, don't make that child suffer. Don't wait to the end when you know the child feels pain when you do that. So we need the fair election, sir. That's why I mentioned that. It's so important for the elderly people who do not want to vote by mail. And with this brought up, this November, you want to push this through. Same fire. Let's look at the inflation, everything else people are suffering. Thank you.
Mark, on one point I agree with you. I wouldn't want the government to step in and tell women what they can do as far as their bodies or aborting a baby goes. That being said, I think it's really important. You haven't said one of the most crucial things about what you're going to support. Is California going to support third trimester abortions? At what point do you want to cut that off? We know that the child is fully formed in the womb after 6 weeks, and after 22 weeks, I believe, it could literally be born or if you were to pull it out of the womb, it could survive and be a baby. So you haven't really said that. It also bears mentioning that while I'm for women's rights, there is no person that if it was you being aborted, there would be no one for abortion. Okay, so, and secondly, no one really is standing up for the baby's rights at all. Even though I don't want the government to step in and tell women what to do, it is murder, and no one's standing up for the babies. No one at all. Also, women, this is including us paying for, like as a society, for women's abortions. And I've known women when I was younger who just, not very many, but there are women who use abortion like birth control. They just have sex, and when they get pregnant, they abort the baby. And they have multiple abortions. And it really makes it very easy for a mother to murder her baby. It's between her and God as far as I'm concerned. Someone probably should stand up for the baby's rights, but I don't want government involved in a woman or in people's rights in general. So it's really hard to say what to do about that. So although I agree with you that women should have their own rights, this is making it way too easy, and the funding is absurd.
Audra, I should get 4 minutes because you guys put 2 items under one thing.
No, according to the rules of procedure, if there's more than 10 speakers on an item, it can be reduced to 1 minute. So the 2 items are 2 minutes total. We'll restart your time.
Thank you. What you're doing is murder. You just sat there and said, let's take a moment of silence for these children that were murdered. Yet you're going to sit here and say that murdering a child is okay. So how do you weigh that? How do you figure that one is more convenient than the other? But it's just like with COVID, like you guys blur the lines of everything. But that is freaking murder, what you're doing to children. And Nora, you're sitting here saying that people of color and that are, don't have access to this stuff. That's bullshit, because they put those freaking clinics in black communities so that they will murder their babies. Everyone has the right to life, and under the Constitution, everybody has the right to life. And you're taking that right from these children. They didn't choose that. These people going and having sex, and that's the consequence of it. So maybe you should think about sterilizing them if they want to do that. because they're murdering these children that have every right to life. I know you're not going to look up, Nora, because you're a disgrace, and you like to rip babies apart limb by limb so they can put them in every fucking thing in this nation. It's in water, it's in the fucking food, it's in the vaccines, it's in all these diseases that they create. And the fact that you are so disgusting that you will say, like, yeah, we should have a moment of silence for those kids, but we should also for the children that are being murdered and ripped apart. They want to go to 2 years for these abortions. Does that mean we can abort you at this point, or you, Nora? Or would that be murder? That would be murder, right? If I ripped you apart limb by limb. You will face our Maker one day. And you will have to own up to all of these choices that you make. And I guarantee you he's going to turn away from you and say, I never fucking knew you.
Thank you.
Time is up. Next speaker.
First time you've enacted your little 1 minute bullshit. You're shadier than an umbrella. Yeah, these clerks, you might as well be like some customer service associate of bullshit. We should be more concerned about what we put inside of us. Obviously, Nora doesn't care because she has more roles in a bakery. She's impregnated with her inhalation of food. And I'm about reproductive responsibility, so I'm somewhere in the middle about this whole thing. Yeah, if you're hitting your skins, then you should wrap it up and have self-control. And wrap that gavel up, B. Rights are just like, if you're fucking up, then it's like you should just get a bailout. It's just insane. And there's no responsibility being talked about, or the side effects of abortions and the health issues are never discussed at all by anybody, not even the so-called Republicans. I wish that you guys were aborted. I don't really wish death on anybody, honestly. But yeah, you talk about like black people and whatever, they're 3 times more likely to have birth complications. That's because they're the most oppressed with the food system. And I appreciate you actually staring at me for once. They're trying to kill us, documentary I mentioned multiple times now. Mayo Clinic says smoking, drug use, there's a bunch of different other health people. Low socioeconomic status, nutritional deficits. Those are the things that are causing like a lot of the complications from, you know, pregnancy and whatnot. And it's, if you actually cared about health, and that's what you would be doing. And you're just aborting our comment, and you're on a soapbox talking about washing out people's wombs and not like dealing with the actual realities of this. It's like everything's complicated, and there's like so many variables you just make black and white. That's like, I don't know, ideologicism, I don't know, not racism. I mean, where do I go to abort my food baby if I don't have enough fiber in my diet? That's a problem. And so $16 trillion, they say, is the cost of COVID. $300 billion you talk about for smoking. That's from the Wuhan, the pandemic. Ooh, your time's up too, I hope. One day.
Take a seat.
Thank you. The final 2 in-person speakers are Chrissy and Margie Morrison. You're welcome to come forward at this time. And if Michael Brando would like to address the board, your name has been called as well.
I will try to be very quickly, but I'm just totally shocked at what you've done to my city and my state. I've told you before, I'm a widow. My husband served in Vietnam.
Could you state your name for the audio record, please?
Excuse me. Margie Morrison. I've lived in this town all my life except 1 year, but I've traveled every summer to the states where she's from, and I've taught in Chula Vista, San Ysidro. I'm a school teacher, and I'm a widow, and all 5 of my daughters grew up without a dad, and after he died, they went to college, and they bettered themselves, and they didn't feel sorry for themselves, and they're doctors now. And they weren't discriminated because of race or color. They got the, anyway, I've taught in the schools, and in 2014, the teachers from California went to the National Education Association, and these are all the rules they voted on, and we were in the faculty lounge. Immigration. They were for, incidentally, years ago, they were not for immigration. They were zero population. They were not for immigration. That's how abortion came out years ago, was zero population. They were closed then. Anyway, federally funded parental options. Reproductive health. They stuck it in. No moment of silence in the sectarian schools. No money for private schools that teach about God. We cannot say one word about God in the schools. So what has happened since 2014? Many of my wonderful teachers who motivated kids to be more than they want to be have got out of teaching. That's why, because our hands are tied if we motivate a child to be different than they want them to be. You're from Chula Vista. You're not representing your district. And she left the room, Tanya. She comes from the New England states, and she's telling us people in Southern California how we're supposed to live. Has she ever taught in a classroom? No. And you're teaching. And this document was sent many teachers out, and it became the platform from the Democratic Party. And that's why I was a Democrat for years, but I changed when they said that it's not a child. It's not a human being. Thank you.
Next speaker.
Chrissy. Nora opened her comments with something to the effect of, women would not be successful but for killing. Abortion is killing, so but for killing. And how appropriate, Nathan, that you asked for a moment of silence for 14 dead children. It's a tragedy. It's a real tragedy. Death and killing is a tragedy. But how absurd that you've said it right before. You're talking about killing over 2,300 children a day, 62 million. I mean, don't you feel like that's absurdity? That you know what death is. Death is awful. And now you're couching reproductive rights, which is killing, sucking a baby out of a womb and inserting a scissors into their skull and sucking their brains out. That's partial birth abortion. And soon it's going to be abortion 7 days after they living. And so what's the difference between 14 children dying and 2,300 children dying per day, 62 million since the start of abortion? And this is a quote from Tolstoy that says, "Every lie is a poison. There are no harmless lies. It is a lie that abortion is not killing. It is killing. And those who deny the freedom to others deserve it not for themselves." You are taking away the freedom of life, the right to life with these legislations. And for that, you do not deserve your own freedom because you've denied it for yourself. And there's Tara, which means dirt.
Thank you. We'll now hear from those that requested to speak by phone. When it's your turn to speak, you'll be unmuted. You'll hear a recording that will tell you to begin your comments after the beep. I would remind callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller.
Good afternoon. My name is Elke Gahn, and this is Appeal to Heaven. Can you hear me?
Yes, we can hear you. Thank you.
Okay. Father God, you have seen what these people pretending to be gods want to do to your children. I do not understand this murder thoughts. Please pull back the curtain of these lying, deceiving Jezebels and cut down the Jezebel throughout our society, throughout our county. This should be a beacon of life, not a beacon of death. San Diego County should be elevated to you, Father, not to these murderers. This is total intent of murder. And Mr. Eldridge, listen up. What Constitution are you talking about? The 1849 or the one administrative law of 1879, which has been changed many, many times? This is ambiguous and not right, what you are doing here. And do not use the word enshrine. There's nothing sacred about murdering. Your intent to genocide is displayed to all the world right here, right now. And please stop it. You are not gods. You have a higher authority over you. Please recognize it and start worshiping the God of the universe. Thank you.
Thank you. Now hear from the next caller.
Hey, Noemia Grego. I'm from District 1. I'm a native born here in San Diego. I was this Firmino campaign, and we go around, trying to fight against this murderous agenda. And it's very absurd how Gavin Newsom is saying that our grandmas or grandpas or the females, let's keep it real, will feel our fury, but yet they weren't murdered. So they're here with us on Earth. So he just speaks for himself, because just like Nathan Fletcher, when you were pro-life, Nathan, you were a Republican, and now you want to slay to whatever agenda you're pushing, which is the murderous agenda, of course, now, while you just sit in I don't know what you're doing, but evidently you're not representing San Diego, and I hope Amy Reichert takes your place. Represent San Diego, not you, not somebody that just sways to whoever pays them off, because both sides are corrupt. You already know that. But truly just stand up for our freedom, our rights as citizens is what needs to be done, because really we need more people like that. And it's just sad. Kids can change their body parts at under 18, but keep it behind parents' backs too. That's something Gavin Newsom wants to do, and protect himself, his own interests. Like, you guys are always going against mothers and parents and everybody. I just hope that this hatefulness stops from Gavin Newsom, because that's who you're representing, Nathan, and you know that that's what you're doing. That's why you're up there. You're bought and paid for. You sway to whatever they tell you to do because of your evil agenda that you constantly push on us.
Thank you. We'll now hear from the next caller.
Eleanor, my body, my choice. Oh, the irony. Oh, the hypocrisy. Tara, I heard you today and yesterday I heard you on KUSI yelling about how a woman has the right to choose what happens to her body. Don't you see the irony in that? I guess women are only allowed to choose what happens to their bodies if their choices agree with you, i.e. the choice to have an abortion, which ties in very neatly to your eugenics program to depopulate the world. We know that you board members pushing Planned Parenthood and abortion is just a way to depopulate the world. You decreed that people need to have poisonous injections into their bloodstreams in order to keep their jobs. What happens to my body, my choice? Where is the choice? Your hypocrisy is astounding. Is it my body, my choice, or is it my body, your choice, whenever you deem that necessary? And then what about a man's right to choose? Does a father not have any say in the life of his child? Or are you saying that men don't have the right to choose, only women's right to choice? This is hypocrisy at the highest level. We know that you don't care about people because you are forcing people to have these poisonous COVID injections. And yet you say that we have the right to choose. We already have the Nuremberg Code that you're violating, which prevents medical experiments. And then you promote abortion so that you can get your fetal cells and your fetal tissues to put in all of the drinks and the water and the food so that you can start causing cannibalism. Is that your agenda? We know that these babies are torn apart and suffer intense pain because it's easier to get the cells and the tissue from them when they're still alive and screaming than when they're actually dead. You don't have any interest in people's rights or bodies. All you're doing is pushing your eugenics agenda on Saturday.
We'll now hear from the next caller.
Good afternoon, our wonderful Board of Supervisors. My name is Sandy Muskowski. I was formerly district in Chairman Fletcher's district, and I'm currently in Vice Chairwoman Nora Vargas's district. I am so grateful to you for bringing this issue forward and taking this to the state. Supervisor Vargas, I am very proud that you are my representative, and I will continue to be voting for you, and I'm grateful to all of you. I have experienced economic security when I was able to work full time, and I've also experienced poverty and homelessness. During those times, I have experienced abuse and sexual assault, and I'm very grateful that I have access to resources to help me make the right decisions for myself and any family choices that I would make. And thank you for protecting those rights for all of us. I'm so grateful to you for making these efforts today. Thanks again.
Thank you. We'll now hear from the next caller.
Robert, Mr. Fletcher, you are a survivor of the abortion Holocaust. Reproductive health is a euphemism. Abortion is not health care, it's murder. Is the comprehensive assessment called for in this measure's title really going to quantify health services performed by abortion providers? Real services like well baby checkups, ultrasound, heartbeat monitoring, and rhesus factor testing? The abortion industry master plan called sex education. The plan involves breaking down natural modesty, separating young people from their parents and their values, so that the providers become the sex experts in their lives, assuring young people will secretly turn to them for services, including low-dose birth control pills and defective condoms, so they do become pregnant, with a goal of 3 to 5 abortions from every girl in the age range of 13 to 19. This is the MO of a sex predator. The reasons why Roe is potentially being overturned are that 1, abortion almost always results in the death of a baby. 2, women are emotionally, physiologically, and spiritually harmed by and regret abortion. 3, alternatives like safe haven drop boxes for unwanted babies exist in all 50 states, which didn't exist 49 years ago. Today, no woman is forced to care for an unwanted baby. 4, there are millions of would-be parents on adoption wait lists. 5, life begins at conception as evidenced by frozen embryos becoming full-grown adults. 6, in cases of rape, it's injustice to impose the death penalty on the child as if the child were responsible for the father's sin. My family and I are San Diego residents that oppose amending the California Constitution to guarantee a right to abortion.
Thank you. We'll now hear from the next caller.
Good afternoon. My name is Bernita Gutierrez, and I'm the Vice President of External Affairs at Planned Parenthood Action Fund of the Pacific Southwest. We proudly proclaim that abortion is health care, and health care is a human right. This year alone, there have been nearly 600 abortion restrictions introduced throughout the country, and the recent draft opinion from the Supreme Court of the United States confirms that the court is preparing to end the constitutional right to abortion by overturning Roe v. Wade. If final, this decision would reverse nearly 50 years of precedent and would have terrible consequences for patients across the country. The impact of abortion bans and restrictive laws is devastating and disproportionately impacts populations that already face barriers to accessing care. That's people of color, people with low incomes, immigrants, LGBTQ+ people, and young people. It is more important than ever for states and local jurisdictions to stand firmly in supporting everyone's right to decide if and when to start a family. We are so grateful to see the county take this important step to assess sexual and reproductive health care services offered by the county and its healthcare contractors. It's crucial for San Diego County to continue to serve as a champion and model for reproductive freedom, and we urge your aye vote. Thank you for allowing me to speak today.
Thank you. We'll now hear from the next caller. We appear to have lost that caller. We'll move on to the next one.
Truth. These items use the anti-women, disempowering, misogynistic values cult language of calling mothers pregnant people again. It also uses the phrase health equity when abortion is one of the #1 killers of Black Americans. With about a 14% total population, Black American babies account for a whopping 38.4% of all abortions, according to the CDC. Horrible, racist inequity. The reality is that abortion, no matter if one supports it in any scenario or not, was and is an extension of the eugenics and depopulation agenda. What most people don't know is that Planned Parenthood was founded by Margaret Sanger, a proud eugenicist. He believed that she was born a racial superior and everyone else was born inferior, defective stock, human weeds that deserved to be sterilized. Sanger was a member of the Human Betterment Association for Sterilization. It's now called Engender Health, whose supporters include Gates Foundation and the United Nations. Tara and Nora, along with Nathan's wife Lorena, were both endorsed by Run Women Run because they want taxpayer-funded abortions and children getting abortions without parental consent. Nora was also a VP of Planned Parenthood. That's the we she was talking about. This item references the Guttmacher Institute, which is a former arm of Planned Parenthood. They work with the UN, focusing heavily on promoting abortion in countries like India, Mexico, and Nigeria. Eugenics is alive and well. Nathan admitted that this item won't stop abortions. All you guys are doing is outing yourselves as bringers of death and players of desperate political theater. Jesse Jackson once spoke the truth when he said, quote, "We used to look for death from the man in the blue coat, and now it comes in a white coat."
Thank you. We'll now hear from the next caller. For the next caller, Judith Howell, your device might be muted. We'll come back to that caller.
Kevin Stevenson. We must strengthen access to reproductive health care. Reproductive health care is more than just abortion. Reproductive health care is very important to keep people healthy and alive. Birth control and contraception are important components of reproductive health care, and it is insane to me, and it should be insane to everyone, that quote-unquote pro-life Republicans. Let's be clear. The Republican Party is not pro-life. These are the American Taliban. These are religious zealots that want to strip women of any freedom that they have. While, ironically, they steal our phrase, my body, my choice, in regards to not doing the bare freaking minimum of wearing a mask during a deadly pandemic, and they want to go around and be disease-carrying pigeons and get other people sick and possibly killed because they're selfish pricks. The right wing in this country is evil. I mean that dearly. I know that might sound like a cartoonish way to put it, but it's the truth. They don't care about life. Once a baby is born, they don't want to provide that baby with any social safety net. So spare me your bullcrap about how you care so much about a freaking fetus. And to the women, the quote-unquote abortion is murder women who vote for Republicans to push this garbage, you're garbage too, because you're voting for your own enslavement. Oh my God. So I am passionately in support of items 24 and 25. And every single person who is speaking out against this and pushing the typical right-wing bullcrap.
Your time is up. We'll now hear from the next caller.
Hi, Supervisors. Paul again. This is an emotional subject, but we've got to think, not spend time on knee-jerk reactions, but maybe this is an opportunity to get women, husbands, maybe even significant others, all united on this instead of carving out another legal niche, which is not even necessary. The state constitution is giving broad rights to individuals, all individuals, for the long term, rather than giving narrow rights to select individuals whenever something comes up, which, by the way, could also be seen as enshrining a form of discrimination. The overview says that the Supreme Court is poised to overturn Roe versus Wade, poised, and allow states to make abortion illegal within their borders. The current case is a Mississippi case, and it may have limited application to other states, and the court may not overrule Roe versus Wade in its entirety. I see no use in panicking and sending out another board letter calling for specific action, for we don't know all of the facts. Further, the actual resolution calls for legislation that will allow the voters to enshrine this right in California. All needs to include husbands, if applicable, as well. I would support a law that says something like, in case of rape, incest, or life-threatening danger to mother or fetus, upon consultation with the husband and medical personnel, just on demand. The California Supreme Court has already said the Constitution's right to privacy.
We'll now hear from the next caller.
Hi, good afternoon. My name is Judith Howell, and I'm calling on behalf of Planned Parenthood Action Fund of the Pacific Southwest in support of these letters. I'd like to thank Chair Fletcher, Vice Chair Vargas, and Supervisor Monson-Raymer for your advocacy on these important issues. Abortion is health care and is still legal across the country, and as of today, it remains our constitutional right, and no one in the state or county can take that away from us. The recent draft opinion confirms our worst fears. The Supreme Court is preparing to end the constitutional right to abortion by overturning Roe v. Wade. If final, this decision would reverse nearly 50 years of precedent and would have terrible consequences for patients across the county. I am grateful and honored that our county is stepping in to prepare for this potential outcome for our residents and people seeking services across the nation. Thank you so much. Take care.
Thank you. We'll now hear from our next caller.
Hi, my name is Art Hodges. I serve as bishop to more than 50 clergy, pastors, and 30 churches in San Diego County. All of them and their thousands of constituents stand for sanctity of human life from conception to natural death. The Bible clearly reveals that life begins at conception. In Psalm 139:16, thine eyes did see my substance, yet being unperfect. And in thy book all my members were written, which in continuance were fashioned, when as yet there was none of them. And in Jeremiah 1:4-5, then the word of the Lord came unto me, saying, before I formed thee in the belly, I knew thee. And before thou camest forth out of the womb, I sanctified thee. And I ordained thee a prophet unto the nations. Also reference Isaiah 44:24, Galatians 1:15, and Job 33:4. Abortion is not reproductive health care, and calling it so is calling evil good and putting darkness for light. Abortion is murder, killing a child in what should be their safest space, the womb. Abortion also disproportionately impacts our African American community. For those supporting abortion by claiming my body, my choice, I ask a question. Did Planned Parenthood ask your permission before selling your aborted baby's body parts? We need to vote today to respect and preserve life, not to devalue and abort life. Our inalienable right to life, liberty, and the pursuit of happiness should not be denied to the most vulnerable among us. Don't vote to aid and abet murder. Deuteronomy 30:19 says, I call heaven and earth to record this day against you, that I have set before you life and death, blessing and cursing. Therefore choose life, that both thou and thy seed may live. Jesus Christ said, even as you do unto one of the least of these, you do unto me. We all will stand before God to give account one day soon. Please today champion moral character and have the political courage to choose life over votes. Thank you. God bless the proceedings.
Chair Fletcher, that concludes public comment on this item.
We've got a motion by Vice Chair Vargas, seconded by Supervisor Lawson-Remer. Before we vote, let's go to Supervisor Desmond.
Thank you, Mr. Chair. Appreciate all the callers and all the comments and all the passion, I guess, on both sides of this issue. You know, I feel compassion for women who have to deal with this situation. I cannot imagine the difficult experience of expecting women. I appreciate the sentiment of this item that discusses protection for health and welfare of pregnant mothers. We should care for and support them, particularly the underserved, and particularly in these difficult circumstances. On item 24, I'm okay with the first recommendation that directs an assessment of healthcare services and barriers to care in San Diego County. But for recommendation number 2, to me the recommendation is too broad in that it may include funding for extremely late-term abortions, which polls suggest most people don't agree with, and allowing it to abort a baby up to the day before it is born without a medical reason is something I just can't support. Item 25, this is enshrining the Constitution.
Can you tell me where it says that?
Well, we're going to go out and look for funding and look for support legislation for abortion. And just the fact that it says abortion and there's no limits on it at all, that's where I get it from.
Okay. No, but that's misinformation, Supervisor.
Okay.
Desmond.
Well, that was my interpretation.
Okay, that's. Thank you. So I just want to make sure that there's clarification. That's your interpretation. That is not what the current law says. So I just want to make sure it's clear, because otherwise people will take that information and think that that's the correct information. That's not
my interpretation.
That's your interpretation. That is not the science.
I'd like to finish my comment.
No, I just want to make sure it's clear, because I think misinformation is one of the things that we want to make sure it's clear. So go ahead, sir.
Okay, I disagree that it's misinformation, but I don't think, on 25, this is the enshrining the Constitution. You know, to me, this isn't a county issue. This is redundant, it's symbolic, and there's going to be absolutely no change. And whatever happens at the Supreme Court in Roe v. Wade, nothing's going to change in California or in San Diego County. Thank you.
Motion by Vice Chair Vargas, second by Supervisor Lawson-Remer. Please vote.
Motion passes with Supervisor Desmond voting no. All other supervisors who are present voting aye.
We're going to go to agenda item 26, an action having our county go on record in support of Governor Newsom's efforts and proposal and the legislation pending before the state around the implementation of care courts. It is clear when we look at the situation that we face on the street with the unsheltered that we have to have more tools in our toolbox of things we can do to try and meet the need. I deeply respect and appreciate individuals' rights and freedoms, and we want to be mindful of that. But it is not humane in any way to allow people to live in the condition that we see them in, some of the most severe and chronic cases of individuals who are clearly not able to make an informed decision and judgment about the situation they face. I don't believe it is compassionate, allowing these individuals to literally at times lie in their own feces, clearly not in a state of mind. And I want to applaud the governor for bringing forward this concept and effort to provide a new mechanism, a new way for court-ordered treatment. And I think that this is an appropriate step. It will not single-handedly solve the problem we face with the unsheltered. The root cause of homelessness is poverty, and we have to continue to tackle the structural issues of poverty, people not making enough money to be able to live. We have to continue to break down the stigmas and barriers around mental health, getting people to access care and help and services, and we have to continue to fundamentally change our approach around substance abuse, encouraging people to get treatment and access, and we have to continue to build out the infrastructure. The reality is, as a society, we don't fund, staff, cite, or reimburse behavioral health issues the same way we do traditional health issues, and all of these things have to change. But when you see the situation we face on the streets today, it is evident that we need more tools, and we need more mechanisms to try and get people into a better state of life, get them in a better, healthy condition, and hopefully have them thrive and live productive lives. And so I appreciate the proposal that's been brought forward. I appreciate Senators Eggman and Dodd for introducing the legislation to create the care court, create the potential and opportunity for court-ordered treatment options. It does require counties to ensure we provide these services, and the reality is that is our obligation as a county, is to provide services to these individuals. And so that obligation should not create any fear in us as a county. It should create a sense of motivation to put in place the systems to help those who are most in need of help. We're acutely aware of the behavioral health staffing challenges we face, acutely aware of everything that we're going to have to do to make this work. I want to add that I think equally as important to requiring services is requiring housing. That service will not render itself very fruitful if that individual is not housed. And I think the combination of housing plus services is going to be really important. And as a county, of course, we also will seek whatever funding we can possibly get to make sure we can provide the best care possible. But I think as a county, it is appropriate and important for us to go on record and be in full support of what is being proposed at the state, and turn our lobbying team to fully support the effort. And so pleased to bring this item forward, and would make a motion to adopt the recommendations in item 26.
Want to second that motion?
Thank you. And let me go to Vice Chair Vargas, who I'm really pleased to bring this item forward with as a co-docket. Vice Chair Vargas.
Thank you, Chair Fletcher. And I want to say that I want to mention that when it first came out, I was one of the folks that was a little bit hesitant about it, because I think it's important that I mention that, because it's taken me a while to really assess the information and the legislation. But really, one of the things that I really appreciate about Governor Newsom is his willingness to be a visionary in this process, and he's done it before. We saw it when he did it with ACA, he did it with marriage equality, and some people were not believers, and he took us across the finish line in some of these issues. And so I'm grateful that he has this vision for creating a process that's really going to be able to treat individuals that are living with really serious mental illness in order to get them the support and care that they need. Supervisor Fletcher, Chair Fletcher has made a lot of the comments already in terms of making sure that people are treated well and believing in their civil rights, et cetera. Want to emphasize the importance of understanding that we are clear that there is a workforce shortage, that we need to make sure that there's a need for long-term care and community facilities, et cetera. I have the opportunity to serve on the committee that's been created for CSAC as your representative, the California State Association of Counties, that has not only representatives from the counties across the state, but also behavioral health representatives from the counties, the various counties, to really address some of the issues that all of us are, trying to ensure are addressed as we're moving forward. And so while Care Court is not the only answer, I think it is a step forward to help those who are suffering and who are unable to help themselves as a result of serious mental illness. And so I really do believe that this will be a first step in that direction. And so the successful implementation of the Care Court will need state funding and defining standards. And so I am happy to support this, and I'll second the motion as I previously said, and look forward to working with our county team and our state legislators to make sure that we have resources and that this is the beginning of great work so that we can address some of the challenges that many of our communities have. I do want to say something, and I want to make sure that I say this in Spanish, because I want to, it's really important, I think, para nuestras comunidades habla hispana. Yo sé que especialmente en las comunidades de Barrio Logan, Sherman Heights, muchas de nuestras comunidades han visto la gran cantidad de personas que no tienen pues acceso a salud mental, y que ha sido un gran problema la situación en la que se encuentran. Entonces, este programa que el gobernador Newsom esa iniciativa, en realidad creo que es una buena solución para poder ayudarnos. Yo los he escuchado varias veces, las personas que hablan a mi oficina, que hablan que tenemos que tener una solución mucho más, pues ya una solución que de veras ayude a las comunidades, porque en realidad las personas no tienen a dónde ir. Entonces vamos a hacer todo lo posible, vamos a tener los recursos para que las comunidades puedan una vez por todas, pues, ver algo que les pueda ayudar, porque sabemos que nuestros jóvenes y nuestras comunidades en realidad están sufriendo mucho, y creo yo que esta es una de las nuevas oportunidades que tenemos para poder ayudar. Así que vamos a hacer todo lo posible para que esa legislación pase y podamos invertir en nuestras comunidades para que las personas que necesitan este acceso a salud mental la tengan para poder salir adelante y que nuestras comunidades mejoren una vez porque en realidad pues sí hay mucha gente que necesita estos servicios que no tienen, particularmente en las comunidades del sur de San Diego. Gracias. So, thank you.
Thank you. Let's hear from our public speakers, and we'll come back to our colleagues.
Thank you, Chair Fletcher. We have a total of 15 requests to speak on this item, 7 in person, 8 by phone. I'd also note for the record that we received 1 e-comment on this item in favor. Any members of the public that requested to speak on this item by phone, please dial into the conference line now using the instructions provided to you. We'll begin with the in-person speakers, beginning with the speaker in favor, Maurice Lyles. You're welcome to come forward at this time.
Good afternoon. Hello, my name is Maurice Lyles, and I'm the Regional Director for Greater San Diego, Orange, and Imperial Counties in the Office of Governor Gavin Newsom. I wanted to thank the San Diego County Board of Supervisors for making Care Court a priority and bringing it forward on today's agenda. The Community Assistance Recovery and Empowerment Court, also known as Care Court, is a proposal to ensure that people with mental health and substance use disorders get the support and care they need. Governor Newsom's new approach, Care Court, is a more effective way to serve people with severe mental health issues, many living in encampments locally and around the state. Care Court is aimed at helping the thousands of Californians who are suffering from untreated schizophrenia spectrum, psychotic disorders that too often lead to homelessness, incarceration, or premature death. Look around in places like San Diego and throughout California. It's clear that the status quo is not working. It's time to connect the dots and make it easier for people and those who care about them to get the help they need. The Care Court response can be initiated by family, county, and community-based social services, behavioral health providers, and first responders. Each person will be provided a public defender and a new supporter, and on top of that, a full clinical team to provide care and connect them to supportive services. We are focused on stabilizing people with the hardest to treat behavioral health conditions without taking away their rights. Governor Newsom is not only calling for this new approach, but supporting this effort by investing $14 billion in homeless and housing services to ensure local governments have the support they need. This plan is currently moving through the state legislature. I wish to thank the Board of Supervisors for placing Care Court on the agenda and working to make sure people suffering from severe mental health issues and behavioral health issues and their loved ones have the care and support that they need. Thank you very much.
Thank you. I'd now like to invite forward the speakers in opposition. Audra, Mark Dorian, Alan C., Jason Robo, Chrissy, and Margie. You're welcome to come forward in any order. You have 2 minutes to address the board. Please begin by stating your name for the audio record.
Mark, globalists want to kill you and your baby and depopulate, so if you're willing to kill your baby, they think that's hilarious.
This item is not about
And yes,
this
and now
item
on
is
to
about
homelessness.
Your comments are off topic. Warning 1.
Now on to homelessness. The homeless, you've destroyed 40% of the middle-class businesses. Of course, the stress is going to cause a lot more mental illness. People that had great businesses, owned homes, had families, have lost it all. Some of them in the rural areas too, from the fires, and because they can't afford their insurance, and you're required to have it for a mortgage, so they're living at the beach in their cars now. I already told you twice now that for, I don't know what you're spending, $1 billion on homelessness and housing, but it's really important for people out there to see the Rosa Corey video. Corey is K-O-I-R-E on YouTube, part 1. There's at least 3 parts, but part 1 is only 26 minutes. It's very important. For less than $10 million, you could immediately build, I think it's 7,500, maybe 8,500 homeless people now on Fiesta Island. It's being used for nothing every night. They have 3D printers now. Appy Score could 3D print 10 by 10s. I have a friend who's a UCSD graduate in literature with honors. He's homeless. He's a gnarly guy, used to love to get in fights at bars when he was a kid, but he's scared. He got beat up being homeless. These people just want a place, a room with access to a bathroom and such would be a godsend to them, so that they're not worried about their head being bashed in when they go to sleep. You could have this problem taken care of within a year, and you could legislate it tonight. There's no excuse that homelessness isn't already solved. You want to keep it going, you're making money off it. I'm out of time.
Yeah, when you're ready. Thank you, clerks. Yeah, Alan C. I actually, believe it or not, I actually support enforcement, which I've been screaming about all this time, that we keep putting people in boxes, yet we don't take care of them. So this, I think it's great that you're actually going to use the law to actually support it. If you can zoom that all the way, sir, I'd appreciate it. Oh, ma'am. Nora Vargas, you walking away wherever you went. Oh, there you are. In Chula Vista, we had a contentious last week about rent, about people basically don't have to pay rent because you, of course, can't afford it. But the question was, why didn't you stop the tax? Just like all these businesses, for 2 years, you didn't stop the tax. How many people lost their jobs and are out on the street right now because you didn't help them out? And I didn't mean helping out, but nobody wants a handout. But you didn't stop the tax as you shut their business down. And as far as in Chula Vista, most of the people down there that was fighting against what was going on was senior citizens, or most vulnerable society, who had renting out the back rooms or renting out a second home, and yet they kept the tax going. So there was a lot of emotion about what's going on, and a lot of these senior citizens said they would sell. Chula Vista, please look at the picture. Chula Vista means beautiful view. That's brought to you by Mayor Salas and the City Council Affordable Housing. Berkeley said back in 2 years ago, $425,000 per single unit of that building. That was before COVID. Have you price checked drywall and lumber today? Are we going to basically let these big corporations for urban living take over these mom and pops, these senior citizens who's renting out their homes and doing that? Look at the poor guy living next door. Is this what we've become? That's not going to solve homeless. Let's treat them, but I do agree with that, sir. Thank you.
Thank you for your time, Margie Morrison. I agree we have to help the homeless. What I disagree with is these constant comments that the only way we can do da-da-da-da-da is money. And I strongly disagree with that as a teacher, having lived here all my life. And I ask you, have you ever heard of Father Joe's Villages? Very, very successful in San Diego County. He has a program that to get them off the street, they have to be willing to come live and abide by the rules. And many choose, now do we want to do with it? Have you ever heard of Teens Challenge? A wonderful, wonderful program that's put on by it's a Christian group. But it was shut down during coronavirus. And I've told you about the rules that they put in the teachers' schools. We cannot say God. We cannot say God. We cannot help any sectarian group. It's in the teachers' rules. It's become the Democratic Party platform. And I'm saying that's what I disagree with. It's constant talk. The only way to help these people is money, 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 instead of turning their life around and encouraging them. Suicide rate among young people is very high right now. But insurance companies know that people who are in a faith-based community and married, they live a long life because their family helps them and they have a belief in a higher being. So that's what I disagree with, that you really take a look at why you always think money, 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 and you constantly tell this to us, which incidentally, the veterans, you represent Coronado, Tara. You are talking against admirals and captains who have gotten out of the military because of Obama's policy of all this stuff that you've come up with. You have lost so many good men in the military. Unfortunately, Dennis Tenise has homes for the homeless. Thank you.
Audra, just like they're saying, I mean, why would you guys want to stop this problem? You wouldn't get any more money. And you act like you care about some people's lives and not others. It's like, why can't we care about all life? That doesn't make sense. Let's murder babies, but, you know, you want to make sure that these people have their civil rights and all of these things, but yet you trample on everybody's civil rights with everything that you do. And then you're like, no, we're trying to save these people's civil rights. It's ridiculous. And no matter how much money you get and more funding that you seek, nothing changes. It actually gets worse. I mean, say in 2020, there was 3,971 homeless, yet you're getting millions and millions of dollars to solve the problem. Yet it just keeps growing. So, I mean, are you ever gonna come up with a solution that actually works, that you actually help people? Because all the things that you talk about, it's like, it would be nice if you were actually doing that, not putting money into your own pockets, into the pockets of other investors and things like that. You could have, there's so much land that you're buying because you don't want the people in it. You could use that to help these people, give them a purpose. But instead, all you want to do, Nathan, is go next to a homeless man and be like, are you homeless? Okay, I'm just going to write that down so I have it. But I'm not going to offer you any help. Because I'm going and talking to these people, and you're not offering them any help. You're not doing anything for them. But you're getting millions and millions of dollars, if not billions, and that's going into your pockets. And that's our money. And you're not doing anything to solve the problem, and that is the problem. Is that no matter how worse it gets, you're just like, we need to seek more funding so we can do something about it. When are you actually going to do something about it?
Thank you.
Jason Robo. Was that off topic? I'm sorry. Oh, yeah, you guys are bums, in my opinion. Yeah, say we're going to solve homelessness. Harmless, I wish you guys were. We've had a war on poverty. What was it, Nixon? I don't know, it's been going on for decades. Apparently we couldn't spare any change to fix that problem. Sorry, I don't mean to bum you out with reality that you're full of shit. I don't know, downtown's like crazy. It's like trying to navigate turds and urine, trails of piss. Who's the camp host? I guess that's law enforcement has to deal with it. There was an interesting story about the public defender earlier. And then also, you know, like a lot of this is really about addiction and mental illness, which if you were actually, you jerk yourselves off saying you're helping with those problems, but they're all interwoven. And then if somebody says something you think's off topic that sees the interwoven fabric of oppression and nonsense you're part of, then you try and like use that as a censorship mechanism. But people have a different vision of the world that you do, and you are intolerant to that idea. But anyways, as far as public defenders goes, I have an interesting story. I reported being attacked by a hitchhiker on the highway on the 101 in Humboldt 10 plus years ago. And I had an interesting dialogue with a public defender and the prosecutor who were chumming it up in the hallway. And I asked, like, what would you guys be doing if we actually had less like legal issues and people were all right? And it was messed up because the public defender couldn't even fathom the idea that we'd have a better world. And then the prosecutor said that he would go help impose their nonsense system in the Middle East, which is not compatible with their civilization or culture. So it's just kind of crazy. And anyways, there's a messed up story saying I was arrested for a concealed weapon falsely, basically, by Kevin Hoover, yellow journalist up in Humboldt. But yeah, 1/6 of our money goes to healthcare, and we're wasting money on it. Same thing, homelessness.
We'll now hear from those that requested to speak by phone. When it's your turn to speak, you'll be unmuted. You'll hear a recording that will tell you to begin your comments after the beep. I'd remind callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller.
Hi. Can you hear me?
Yes, we can hear you.
I think a couple of people before me had already stated that. Hold on a second.
And can you please state your name for the audio record?
Yes, my name is Noemi. Abrego. From what that other guy was saying up there about Chula Vista, the taxes are getting awful. Like, a lot of people are becoming homeless that I know of because of the high taxes that are being imposed on us. And some of them are fleeing California already because of it. Thank you, Gavin Newsom, your little buddy, huh? Gosh. Yeah, they're squashing us, man. So other than that, it's really bad. Taxes are bad. Like, everybody that voted to go against the gas tax, like Akila Weber and like all the other two on the gas tax, it's bad. We need to start thinking about the small businesses or the middle class now, because we're being screwed over. It's bad. And it's awful that these people get to do whatever they want, but it'll catch up legally, I'm sure. And I'm sorry, but I'm so happy I saw the light to be a conservative. Spewing hate, Nathan, seriously. The right-wing stuff, you need to stop the division. That's why we want you out, because you're so awful, and you are not a good leader. Stop taking photo ops, too. You look ridiculous.
We'll now hear from the next caller.
Good afternoon, our wonderful Board of Supervisors. My name is Sandy Miskowski. I have lived experience with homelessness, and I work with Lived Experience Advisors, Heal Network, and Run California. Chairman Fletcher, I appreciate your wonderful leadership, and I thank you for emphasizing housing in regards to this issue. Mental health and substance use conditions are exacerbated by living homeless. No one can stabilize without housing and supportive services. While I've lived both housed and unhoused in central San Diego, I have known my homeless neighbors well. The severe cases of mental health and substance use that are rare and may warrant conservatorship are this severe because of past policy that has abandoned these individuals to live on the streets for an average of 7 to 10 years. Thank you for taking efforts to prevent this from continuing to happen in this way. While I have experienced poverty and homelessness, I have experienced extensive violence and sexual assault that has exacerbated my own physical and mental health conditions and disabilities. Some individuals turn to methamphetamine to stay awake to reduce the violence and sexual assault experienced on our streets, as well as the violence and volatility that occurs in all of our congregate shelters. We do need more tools to address the most severe cases of mental health and substance use. Please ensure that the care court option is used with extensive caution and is rare, and there is sufficient behavioral health staff and case management that can connect with all homeless individuals at least multiple times per week to ensure every individual experiencing homelessness have their needs met. And therefore, care court and conservatorship would be limited to only the most severe cases where behavioral health services and case managers have extensive knowledge of these individuals' cases before these individuals would be recommended to care court. Again, thank you for taking care of our county.
Thank you. We'll now hear from the next caller.
Truth. COVID-19. Off topic. Hello. The county once again regurgitated Gavin Newsom's words in the item. Here in this item, we have more homeless housing programs, which means more taxpayer money will be spent and more land will be taken off the market for regular homes. This care court framework means 2 years of taxpayer-funded services that are court-ordered. So the court is going to force some homeless person into a program and into a forced housing plan, a very cruel form of cleanup. This item talks about creating a new system of care, workforce, and infrastructure. Infrastructure means even more Potemkin affordable homes to be built. A new system of care includes forced medication and forced medical treatment on homeless individuals. The item admits that the county has nowhere near enough workforce of behavioral health, public defenders, public conservators, court administrators, and nonprofits to address the inevitable increased requirement by the framework. Acceptance by the state's care court framework actually enables the state to overstep its legal authority and have a court fine the county for noncompliance, or to appoint a receiver to provide treatment to a homeless individual at the county's expense. This whole thing is an illegal atrocity that will put anyone homeless into a situation where a state care court can force programs, medical treatments, drugs, and housing plans on them. Once again, just like the eugenics era, institutional incarceration. COVID-19.
Thank you. We'll now hear from the next caller. For the next caller, Eleanor, your phone might be muted. We'll come back to you.
Hi, Supervisors. Paul again. You want to establish a special care court addressing the needs of vulnerable and homeless populations, as if we don't have courts already. The overview says the county is charged with providing care and support to our most vulnerable populations. So what's new? The overview adds collaboration, resources, and support on the parts of all levels of government are required. Well, we should know what all these other levels of government have done in the age before we commit to spending taxpayer dollars on any plan that connects a person with 24 months of services, which include a clinical support services and a housing plan. Why should we foot the bill? Nathan, collaboration, resources, and support are available from other agencies. What the care court, an extra full employment, either or not, we do not need further or delay in the courts relying on the current situation. Much so.
We'll go back to that last caller.
Eleanor, I wanted to talk about something Nora said, that healthcare is a basic human right. Before I do that, Nora, how much did you get paid to become a believer? I'm just curious. And then for Tara, I think your name has been misspelled. I think it should be Terror, because that's what you're doing. You're terrorizing the citizens of San Diego. Healthcare is not being given as a human right. And I'm going to give you an example. The senior citizen who was denied hospital access because of refusal to have a PCR test. Now, despite the fact that there's a patient's bill of rights, which says that a patient has the right to refuse a medical procedure, that patient was refused access to the hospital and to a potential life-saving surgery. So what human rights are you talking about? Human rights for those people who agree with you and no human rights for those people who don't agree with you? When did we go from a democracy to a communist or fascist state? I'm curious to know. I also want to tell everybody, if you really want freedom, vote for Renee Senum for governor. She will restore your freedom. Without bodily autonomy, there is no freedom. Tara and Nora don't want us to have any bodily autonomy, and nor does Nathan Fletcher. They just want us to be their slaves, and they want us to be subjected to their medical procedures. That's the only thing that they know what to do.
Ma'am, your comments are off topic. You need to talk about homelessness, please.
Oh, I'm sorry. I thought that it was my turn to talk on public comment. I thought it was a non-agenda item.
It's on the agenda item. You need to speak to the agenda item we're on.
Okay, well, that goes for all the homeless people too. They are just being forced to get COVID injections and forced to undergo medical procedures and being given psychotropic drugs by Big Pharma. So anyway, I will say the rest of what I wanted.
Chair Fletcher, that concludes public comment on this item.
Supervisor Wasson-Reamer.
Yeah, just a couple of thoughts. First of all, I want to thank my colleagues for bringing this item forward. We obviously have a huge challenge in our community across our state, and appreciate the leadership of the governor in bringing forward this approach because we need more tools in the toolbox. You know, I think I just want to comment on a couple important notes. First of all, protecting individual rights is really, really fundamental to me as a value, and you know, really respect the advocates in the community who are so focused on this, and that is one of the reasons I really appreciate all the safeguards that have been discussed that will be incorporated into this bill moving forward to ensure that there are advocates for individuals and that the individual really is at the center of the conversation, and the well-being of the individual is at the center of the conversation. I think that is the right approach, and those safeguards and the idea of having those advocates is an important piece of the process, and I'm happy to see that that's part of the conversation as this bill and legislation evolves. You know, I think the other thing we have to note is it's going to take a lot of resources to implement this, and I know there are a lot of conversations about how to ensure that along with these new tools will also come resources from Sacramento to help us do what we need to do down at the local level at the counties. So, you know, again, want to make sure that part of our advocacy is ensuring not only that we're advancing this really important legislation, but also that we will have the resources that we need for implementation to be real and meaningful, and not just empty promises. So again, I think we are all trying to do everything we can, and thank you so much for my colleagues for your leadership on this.
Thank you. Supervisor Desmond.
Thank you, Mr. Chair. Hey, I really want to thank you and Supervisor Vargas and Vice Chair Vargas for bringing this forward. This is a good one. This has been kind of long awaited. Appreciate what Care Court, it's not just throwing more money at, it's a tool in a toolbox where we can help people on the streets that are severely mentally ill or just mentally ill, and we can get them into programs. And we certainly need other ways and new ways to help the homeless and those suffering from mental illness out on the streets. And I think this is a great program. I'm in full support, and it's just as Supervisor Lawson-Reamer said, that with a caveat, the state's got to provide the funding. And the local jurisdictions, we got to work with them, you know, hand in hand, and partnering with them with housing, and to make this a long-awaited measure a success in San Diego County. So thank you.
Thank you, Supervisor Desmond. We've got a motion by myself, second by Vice Chair Vargas, to approve the recommendations in item 26, expressing our full support for the governor's efforts around Care Court and the appropriate legislation. With that, please vote.
Chair Fletcher, that motion passes with all supervisors who are present voting aye.
Concludes the items on our agenda at each meeting. I want to ask my colleagues if they have any updates they would like to share on board committee reports. Supervisor Desmond.
Well, it's not necessarily a committee, but on June 8th from 6 to 7:30 p.m. on Zoom, I'm going to be partnering with Summer Steffen along with the DEA Task Force 10, the U.S. Attorney's Office, the medical examiner, and medical professionals to give parents an overview of the fentanyl problem in San Diego County, and hopefully provide them with the tools and how they can talk to their kids about the dangers of fentanyl. So that's June 8th, 6 to 7:30 on Zoom. Sorry, it was a commercial, not an update, but.
Yeah, fair enough. Good. Fair enough. It applies the same. Supervisor Wasson-Reamer.
Yeah, thank you so much. Just a quick update. I mentioned this previously, but the work that we're doing through SANDAG on housing, and particularly around bringing forward the possibility of having a housing finance authority to make San Diego County as a region more competitive as we compete for state funds. You know, we're really falling behind San Francisco and Los Angeles in our ability to get in line for state housing funds, and that's moving forward. There's been sort of 40 stakeholders involved in this task force consultations that have come to a pretty solid recommendation, and that is moving forward over the next couple weeks. And so I will be bringing that back for formal support and endorsement by the board, but it's just really exciting to see that we are actually potentially going to be able to do something on housing. So.
Awesome, thank you. Vice Chair Vargas.
There's a lot of reports that I can give, but today I just wanted to publicly thank the Parks and Rec team. I think that if you know me, you know that the bathrooms for the Southwest Little League are a big deal to me because the 250 families in South Bay haven't had bathrooms in that community for many, many years. We were able to get them some, and they were vandalized last Thursday, and so the kids on Saturday were not going to have bathrooms. And Jason and Joe from our Parks and Rec community went out there and they worked on them. I was able to get out there on Saturday morning, like I think it was about 8 o'clock in the morning, and they already had a bathroom out there for the kids. And so I just wanted to publicly thank our county staff. They are just an example of so many other of our county staff that are just always going above and beyond, just helping our community. And I feel like there's numerous lists that I can record, but I just wanted to get out there and just say thank you. The young woman that was in the concession stand said to me that they have never had so many people help them, and they were very, very grateful. So thank you for helping the kids in the Little League, because people have to be able to play ball, so important. And so thank you very much for making their Saturday just happen, and those families very happy. So muchísimas gracias.
Thank you. Thank you, everyone. We have one adjournment in memory today. I'd like to adjourn our Board of Supervisors meeting today in honor of my dear friend Al Pavich. Al passed away on May 10th, 2022, just a few short weeks ago. He was born in 1950 in Southern California, and upon graduating high school, Al enlisted in the Navy. He was immediately deployed to Vietnam, where he served with honor. A Mustang officer, he was commissioned after having served enlisted. Al did 30 years in the United States Navy, a combination of enlisted and officer. He retired in 1998 as a commander. Upon his retirement, he felt a need to continue to serve, and he became the chief executive officer at what the time was Vietnam Veterans of San Diego, what we now today call Veterans Village of San Diego, and dedicated so much effort around helping homeless veterans. But more than that, he was a broad presence in the community across the board, particularly in issues of veterans. I remember at a very early age, many years ago, meeting Al. I was a young Marine who had just returned from my first combat deployment. And Al stopped me at a veterans function. He asked how the deployment had went. My generally vague non-answer was sufficient for him to say it sounds like it was pretty tough. And then he talked to me a lot about what he had gone through, what other veterans had gone through, what we were likely to experience in the future. Al had an intensity that would grab your attention, and he had a kindness that would move your soul. And we said goodbye to him on the USS Midway on Monday morning, and I was struck by the number of people who spoke and the number of lives that he had touched. And everyone spoke of the same way, of his incredible kindness, his grace, his compassion, so much of what he represented. And it wasn't just veterans he touched, the number of people that he welcomed into his home, the children and families that he touched, him and his family touched. And I think in so much of what we see today, someone who's not only committed to their community, committed to service, but really committed to one another. And he will be deeply, deeply missed. He's survived by his wonderful wife, Darcy. They shared a tremendous life together, a Navy career, commitment to our veterans after. He's survived by his mother, Candy, his children, Candace and Kimber, his brothers, Steve and Marty, and a community that is eternally grateful for the life that Al lived and the impact that he had on so many. And so we adjourn our Board of Supervisors meeting today in honor of Al Pavich. With that, we will resume non-agendized public communication.
Thank you, Chair Fletcher. We have 18 remaining speakers, 9 in person and 9 by phone. For those that requested to speak by phone and didn't speak earlier today, please dial into the conference line now using the instructions provided to you. We'll hear from those in-person speakers first. I'd like to invite forward, if you're present, would like to address the board, Michael Brando, Alan C., Mike Borello, Lisa Garcia, Miriam Laranaga, Audra, Jason Robo, Mark Dorian, and Consuela. If you're present and would like to address the board, you're welcome to come forward now. You'll have 2 minutes to address the board. Please begin by stating your name for the audio record.
Audra. Vaccines are supposed to provide recipients with immunity from infectious microorganisms by stimulating the immune system. They're supposed to be safe and effective. Safe meaning they do not kill, seriously injure, permanently disable people. But somewhere along the way, public health convinced many with the notion of greater good, as long as benefits outweigh the risks. The right thing to do is vaccinate everyone. Some people might die or be injured, but that's okay. Benefits will outweigh the risk for the population as a whole. The vaccinated will presumably be spared death from infection more than will die from vaccination. The number dying from vaccination, hidden, suppressed, ignored. What many have failed to see is the reasoning is the loss of ethical ground. It is not ethical to kill even one individual with a vaccine that might otherwise survive infection so that many will be presumably saved. That's like throwing the virgin into the volcano to appease the gods, but with vaccines, all appears more scientific. It is big pharma that should repetitiously appease the astronomical profits. COVID-19 vaccines have clearly caused many deaths and very much pain and suffering under unethical public health policy, but it's more so immoral. It's all well documented in the reports of Mike Borrello, who submitted this to this council over many months. These reports, all derived from authoritative sources under the CDC and NIH, will serve as evidence you were well informed. You have all been well informed what these vaccines have been doing for a very long time. And you do nothing about it. You continue to let people die, be injected with HIV, and furthermore, bioweapon that you're trying to claim that you're protecting people against. And it couldn't be more dangerous and evil. And what you should be doing is stopping these vaccines, not pushing it, and pushing this county into even more death as the policies that you enforce.
Yeah, go, Audra. Hell yeah.
Thank you.
That's what's up.
All right, first warning. Your time's up. Sit down.
That's your warning.
Speaker. Conduct disrupting the flow of the meeting. Second warning.
I got one too, Nathan.
Continued efforts in disrupting the conduct of the meeting. I'm asking the deputies to remove you from the.
Are you kidding? Are you going to arrest me? Do we want to go to jail again? How fun is that?
Whose is bigger?
I know, right? Mine's bigger than yours, Nathan.
Next speaker. Please escort her out.
Escort me out for what?
Next speaker. Next speaker, begin. Start his time.
Hi, Alan C., if you can run the video. They're taking my time. The video's not ready. You can pause the time,
Begin
sir.
your time.
You can't really put it all on the war and Putin. I get that we've seen sharp spike in energy and food prices since then, but we're seeing rising prices everywhere, and particularly in housing with rents and shelter in places like apparel that have been rising for the last few months. That's much broader than just what we've seen as a result of the war.
The increase in prices obviously long predates the war. We've been seeing inflation rise for most of the past year. In fact, for the last 6 months, inflation has been above the Fed's average target of 2%. So this is not just about the war.
Tax. Price of chlorine doubled.
President Biden taking questions from reporters on the Nord Stream 2 pipeline running through Germany. The president said he allowed it to continue because it is nearly finished. The administration received bipartisan backlash for waiving sanctions on the Russian company building the pipeline after canceling the Keystone XL.
That's a great asset. More inflation.
More inflation, thank you.
Prices have gone up, and families and individuals are dealing with the realities of that bread costs more, that gas costs more.
Are you kidding me? The bread costs more, the gas costs more? These are the clowns that are running our country. She got it backwards. She's briefed by very smart people that actually said the price of diesel is affecting the delivery costs of everything else. Meanwhile, our own GOP, yes, both sides, are backing $54 million to another damn country that's half half communist. Look at our streets, our own people are suffering. I do thank the board for this gas tax to scream, but we need to keep screaming because we are suffering in this country. Thank you.
Consuelo, to the people at home, they have convinced us that we need them. They have lied, cheated, stolen, and they have killed. Yet we still bow down to their authority, asking for permission. Reminder, they are the few, we are the majority. The so-called elite, they are the evil. They are not good. Good actors with bad hearts. They will never win. One thing they cannot handle is a well-informed and armed society. In reality, we don't need them. They need us. The spell has yet to be totally broken, but the lifting of the veil, el apocalipto, the great reveal, is taking place as we speak. The once divided people are waking up to the division, especially the division of flesh and spirit. The real enemy will be exposed. Just as religion does its followers, so does government. Government thrives on dependency and discourages independent thought. They get off on control and being tyrants, and we, the many, allow it. It is up to us to alter the course. We are who decides how this all ends.
Jason Robo. I'm dedicating my comment to Dr. Rashad Ritchie, or Dr. Bitchy. He is a bottom feeder of human behavior. I think he's a Karen because he's quite obnoxious and a bit like a white woman. He looks like he eats ass. His mouth is puckered like he sucks up. I guess that's the way he worked himself up from the Turkish bathhouse on the Young Turks, maybe with Kevin Stevenson. Yeah, he likes to doctor the facts. Is that what makes him a doctor? I'm not a Trumper, so indisputable my ass. And if you investigate instead of instigate, then you would find out that my K-Mud dismissal didn't come into effect from my radio station until 2022. And this is the county of San Diego, not the city of San Diego, so he could stand by his lies all he wants. And I was talking about the COVID-19 emergency on November 2nd. I'm not a failed politician. I lost by 60 votes. Nathan Fletcher lost an election too. He doesn't look like he runs anything except for his mouth or maybe something involving a toilet. I have these pictures I've seen of him flexing his blubbery biceps. I would suggest more watermelon and less chicken. If you want to actually help something, you should watch the documentary. They're trying to kill us about how there's genocide basically through the food systems, which looks like he likes to indulge in himself, and that they've literally tossed the salad. And yeah, that joke eats ass just like he appears to want to. If he wants to give some shit to some kind of white Karen, he should maybe direct his attention to Colonel Sanders. Instead of Black Lives Matter, maybe it's Black Lives Fatter. You should worry less about terminology and actually setting terms that might help Black lives. He's another yellow journalist, just like Ken Stone from the San Diego Times wrote a hit piece on me. An interesting thing about the Young Turks, the revolutionaries, some of them were Albanian. My last name is Robo. I don't see anything in the history books about them incorporating house Negroes. I challenge him to actually have a dialogue. I doubt that'll happen. Thanks for putting the nice picture of me spinning fire and looking ripped on there. I'd like to see you shirtless. And by the way, 2 million views for my Chris Rock mix, more than any of yours. Fuck off.
We'll now hear from those that requested to speak by phone. When it's your turn to speak, you'll be unmuted. You'll hear a recording that will tell you to begin your comments.
I'm next.
Go ahead. Thank you. I didn't see you. I apologize.
Mark, you, Chairman Fletcher, have no credentials in meteorology. John Coleman, who founded the Weather Channel and was awarded Broadcast Meteorologist of the Year by the American Meteorological Society, is extremely reputable and qualified. In a YouTube video entitled John Coleman of KUSI, How the Global Warming Scare Began, he details the global warming scam. 1883 to 1888 was a mini ice age, lowering temperatures by 1 degree Fahrenheit. This caused food shortages across the northern hemisphere. To quote a 2015 Science.org article, scientists have predicted that Earth is 15 years away from a mini ice age, the Telegraph reports. So the Earth is healing from an 1883 ice age that lowered temperatures 1 degree Fahrenheit 140 years ago. And the 1.4 degree rise in temperature is just normalizing and helping to stop the next ice age in 2030, 0.4 degrees. This scientific perspective was conveniently left out of the recent climate change scare tactics, lying in other words. William Happer, professor of physics emeritus at Princeton University, denies any climate crisis. He is former director of the Columbia Radiation Laboratory, director of energy research in the U.S. Department of Energy, deputy assistant to the president, and senior director for emerging technologies at the White House National Security Council. He denies any climate crisis, as do 31,478 American scientists, including 9,029 PhDs in writing. But you need a very frightening shock doctrine to scare people into giving up their freedom and control of their private property. Total genius Dr. Shiva Ayyadurai holds 4 degrees from MIT, including a PhD in biological engineering, 2 masters. He invented email. I don't like Trump or Biden, but you must all see this YouTube video titled "To Understand the Criminals Stealing Your Money." It's very short. Debate over, genius wins, Fletcher loses completely. He and his cohorts are an authoritarian corporate oligarchy, pulling the scam on we the people. And 2 minutes for 20 items is a joke.
Time's up. Next speaker.
Not seeing any further in-person speakers. Now we'll move to those that requested to speak by phone. I would remind callers that they should mute their TV or live video stream before they begin speaking. We'll begin with our first caller. Andrew?
Truth. Shout out to the live chat. A doctor even gave me hearts. Seriously, I can't stand injustice. On May 11th, Nathan, your throwing around of the word slanderous to justify cutting Audra's comment time was pretty pathetic. There's no nice way for me to say that. I didn't like what I saw at all. Slander is something that has to be proven in court. Otherwise, you are actually the one who's committing slander by saying she did something that hasn't been proven. But everyone understood what your warning of being wise meant, just the same as everyone can watch the video evidence of what Audra was referring to. You know, believe it or not, Nathan, I understand some of the reasons why you have to sometimes be hard in your role. You're protecting more than yourself, and you're supposed to be representing the people of District 4. But Nathan, your behavior of late is beginning to cross into the threshold of abuse of power. Personal animosity is very clear, and it's becoming a sideshow. County employees have told me that they're disgusted by it. It's no wonder Audra had to bring a gavel today. It's one thing to make your comments at the end of someone's speech, no problem. But the constant interruptions just because you disagree with someone else's perspective, it's against your own rules and it's not legal. You're in the process of denying certain individuals the constitutional right to redress their grievances. Both the national constitution and the California constitution explicitly ensure this right. The only positive I can say is that it's never too late to change your ways. A little tranquilo can go a long way. So Nathan, you need to ask yourself in the future, was the battle worth it if it makes you lose the war?
Thank you. We'll now hear from the next caller.
Eleanor. First of all, I want to say thank you to Truth. Truth, you are amazing, and I agree with everything you say. I want to discuss what Jim Desmond said earlier about him wanting to help those suffering from mental illness. If that is the case, I think you need to start with yourself and the entire board of supervisors, because it seems to me that they're all suffering from some sort of mental illness. Who in their right mind would advocate the killing of children and the elderly by lethal experimental injections? Who in their right mind would advocate poisoning our food sources with toxic fire retardants? Who in their right mind would want to add fluoride, which was used to calm the Jews during the Nazi Germany before they went into concentration camps, into the gas chambers? Why would you want to put fluoride in the water? Doesn't seem to me like any one of our board of supervisors is in their right mind. I think they all need to be assessed for their mental stability. And Tara, you say you are research driven. What research is it that drives you? Is it the research from George Soros? Is it your boss who is paying you? We're going to soon have, now we're going to have smallpox vaccines because of this new scam of monkeypox. So just as far as research is concerned, there have been 0 deaths from smallpox in the last 40 years, but there have been 5,755 injuries and deaths from smallpox vaccines. What does your research drive you to do, Tara? This Board of Supervisors needs to stop destroying small businesses, stop advocating genocide, and stop advocating killing, because eventually you will be held accountable and it won't be pleasant for any of you.
Thank you. We'll now hear from the next caller.
Hello, my name is Joshua Shelton. My reason for speaking today is to call attention to the painful process of obtaining permits from the County of San Diego. From March 2021 to date, I have invested approximately $10,000 to build a 500 square foot addition to my home. I have yet to break any ground, purchase any materials, or dig a single hole. My current home is 1,750 square feet, sitting on a half acre. I have been told this is an easy project. However, I have been required by the county to utilize an array of experts, from environmental engineers, soil testers, septic specialists, architects, and structural engineers. I have paid the county close to $5,000 since April of 2021. It took 7 months to approve a septic relocation, which I cannot even begin yet due to waiting on a building permit. On January 20th, I applied for a building permit. Currently, it's held up in zoning. And my architect anticipates another 2 to 3 months to obtain a variance, which will cost me an additional $4,000, all because I'm within 2 feet of a variance and my home was built in 1970. For a responsible homeowner who's paying thousands in taxes to the property, this is unacceptable. I didn't think that waiting this long for a permit would equate how long I waited today to speak to this county. And I find this shameful, and I ask the county, please help improve this process to protect homeowners from this rising inflation, and let us get these bills done that we want to do. Thank you very much.
Thank you. We'll now hear from the next caller.
Barbara Gordon, thank you for letting me speak this evening. As California legal cannabis market matures and expands, there is an urgent need for more clear, accurate, and comprehensive health information for California cannabis consumers. This bill will require labels that effectively communicate the key health warning messages for mental health, edibles, driving, use during pregnancy, and other clearly established risks, by requiring that there will be clearly visible labeling that appear on the front of the package and on the advertisement. If this bill passed, it would provide accurate, visible, and science-based health and safer use information. 83% of Americans think that where cannabis is legal, labels should help them identify safe and legal products. Awareness of the harms of cannabis is already low and continues to decline. I would respectfully encourage the Board of Supervisors to write a letter of support for California Senate Bill 1097 for the health and safety and welfare of all residents. Thank you.
Chair Fletcher, that concludes requests under public communication.
With that, we stand adjourned.
The board will reconvene tomorrow, Wednesday, May 25th, 2022 at 9 a.m. for the planning and land use session of this meeting.